Start. Good morning, everyone. Good morning. Welcome to Philadelphia City Council. Is this working?
It's working,
Yeah,
it's on. Put it closer to you.
Yeah. Welcome to Philadelphia City Council Committee on Public Health.
This is your hearing.
Yeah. But where?
Let me get your gap.
Maybe they hear Mallet hitting tape.
Too much talking.
Hey,
Take your time.
Hey, good morning.
Good morning. How you doing? Someone you said what I said?
If they're not listening.
Get your hand.
Just to get them
Let's
quiet.
speak up.
Yeah.
Let's speak up. Do your
Is she
thing.
gonna give that one? Are we gonna get the that one? No, okay. Okay, let's go. Good morning, everyone. Welcome to Philadelphia City Council's Committee on Public Health and Human Services. I now note that the hour has come. Mr. Sham, would you please call the roll?
Chair Ahmad,
Present.
Vice Chair Lozada,
Present.
Councilmember Thomas, Councilmember Driscoll, Councilmember Bass, Councilmember Landau, Councilmember O'Rourke, Council President Johnson is also present.
I note for the record that a quorum of this committee is present and this hearing is called to order. This is a public hearing of the Committee on Public Health and Human Services considering testimony on resolution number 250936. Mr. Sham, would you please read the title of the resolution?
Resolution number 250936, authorizing the Committee on Public Health and Human Services to hold hearings to examine the impacts of the current crisis threatening the Supplemental Nutrition Assistance Program, SNAP, and Supplemental Nutrition Assistance Program Education, SNAP-ED, on food and nutrition security in Philadelphia, including barriers to accessing benefits, disruptions to nutrition and education and outreach, consequences for residents, and opportunities for coordinated city and community response.
Before we call up the first panel, I would like to recognize Council President Johnson for some opening remarks. Excuse me, one addition, I just want to recognize our colleague, Councilmember Curtis Jones Jr., Mr. 4th District is here.
Good morning, everyone.
Good morning.
Good morning, everyone.
Good morning.
I want to first and foremost thank Chairwoman, Councilmember Dr. Nina Ahmad for hosting this hearing. I want to thank all of you for taking time out of your day to be here as we address the pressing crisis threatening SNAP and SNAP-ED. I want to also thank all the members of City Council for joining us, including Councilmember Rue Landau for being present, Councilmember Isaiah Thomas, Councilmember Nicholas O'Rourke, Councilmember Ketsi Lozada, and also Councilmember Curtis Jones Jr., who's not a part of this committee but thought it not robbery to take time out of his schedule to be here as we address this issue in this moment in time. I also want to thank members of my Food and Nutrition Security Task Force for joining us today to speak on this critical issue, and to recognize my two co-chairs, Mark Edwards of the Food Trust and George Matisek of Share Food Program, for their leadership and partnership in our efforts to ensure Philadelphians are fed. On October the 23rd, I introduced a resolution calling for a hearing of the Committee on Public Health and Human Services to examine the impact of the current and ongoing crisis threatening SNAP and SNAP-ED on food and nutrition security in Philadelphia. Over the summer, the federal government passed a budget reconciliation bill that devastated SNAP and SNAP-ED. Thousands of Philadelphians face losing their benefits, and many programs providing vital nutrition education are now facing complete defunding after this year. These are two critical programs, lifelines for millions across the country and for the over 470,000 people here in Philadelphia that receive SNAP. The recent federal government shutdown dealt yet another blow, delaying November SNAP benefits and leaving many Philadelphians anxious about how they would feed their families. And although a federal ruling has restored partial funding, which is still unacceptable, countless families still face hardship heading into the holiday season. I want to publicly thank our Mayor Sherelle Parker and her team on their swift action through the One Philly SNAP Support Plan, which is directing resources to organizations on the ground. And I thank her for working with me to ensure food reaches Philadelphians who need it the most. I want to take a moment to also acknowledge her Chief of Staff, Tiffany Thurman, and also Vanessa Garrett-Harley for making sure that the resources are going to the organizations in an immediate and expedient fashion. But while this immediate crisis has drawn our attention, we must also recognize that food insecurity has always been a long-standing emergency here in the city of Philadelphia. 30% of children here in the city of Philadelphia are food insecure. That's 1 in 3 children go to bed hungry. That's 1 in 3 children go to school hungry. And so although we're addressing this issue in this moment in time, we have to also make sure we're addressing a long-term strategy to address food insecurity here in the city of Philadelphia. According to Feeding America's 2023 map, the Meal Gap report, more than 277,000 Philadelphians, that's 17.66% of our city, struggle with food insecurity. The burden falls disproportionately on communities of color, with 30% of Black households and 33% of Hispanic households lacking reliable access to nutritious food, and more than 30% of Philadelphia's children experience food insecurity, affecting their development and educational attainment. And we wonder why sometimes when our children go to school and they're reprimanded for their behavior, we're not addressing the overall aspects of why they're behaving the way they're behaving, because some of them come to school hungry and are acting out. These numbers reflect a reality that existed before any federal cuts. I'm gonna say that again. These numbers reflect a reality that existed before any federal cuts or shutdowns, a reality where too many of our neighbors were already hungry. Through my convening of the Food and Nutrition Security Task Force, I've learned that addressing this crisis requires building sustainable food systems and strengthening our local food economy. I've also learned how vital nutrition education is to alleviating food insecurity by helping families build long-term food resilience and empowering communities with the knowledge and skills to make healthier, cost-effective choices. I'm grateful to the many leaders and advocates here today who are doing this work every day, and I'm hopeful through our united effort we can continue to feed Philadelphia and build a more secure and equitable future for all. And as I was preparing my notes, I thought about how, although I'm a graduate, University of Pennsylvania Fell Center of Government, graduate of Mansfield University, where I got a Bachelor of Arts degree in criminal justice with dual minors in philosophy and sociology. Went to Harvard Business School, where I got a certificate in nonprofit leadership and board management. Served as a state representative under Governor Eric Rendell and Tom Corbett before becoming the first African-American to represent the 2nd Councilmanic District. And even serving as the City Council President, I remember humble beginnings, where we have our check days. And as some of you may or may not know what check days are, that means your family would get a number. And on that number, we would go to the 3-2 Center in South Philadelphia. It was located at Broad and Federal. And whatever your number was that day, your day was number 6, we would stand in line to get our, at that time, SNAP benefits. And I remember, as a kid, the most exciting time of the month for me was check day, because we would go shopping. And I remember we would go shopping, we would have a shopping cart full of food, right, that would start our month. And I remember as a kid just growing up, for me, you have to think about them humble beginnings, because sometimes you get in these elected positions, we forget where we come from, but I'm never ashamed to talk about how I grew up. And I remember, like, Captain Crunch being my favorite cereal as a kid, right? Then they had the Crunch Berries, right? But all that was a part of me growing up and us being on public assistance as a kid. So although we talk about these numbers, there are faces. There are faces behind these numbers. There are people who are here are significantly being impacted, while individuals play politics on the backs of those who are most in need. So we're not here for fanfare. We're not here for likes today. We're here to really get some things done and also make sure that, one, we implement this particular initiative effectively as we respond to addressing the temporary SNAP cuts, but also begin looking at a long-term strategy to address food insecurity here in the city of Philadelphia. And for me, we have no other more critical issue, because at the end of the day, when you talk about poverty, I know we are no longer the largest poorest city in America. We're number 2. Which still means there are children, there are families going to bed hungry. There are children, there are families waking up hungry, and it's up to us to be on the front line to help those families working together. And so with that being said, I'm going to turn it over to my chair, and I want to thank my chair. And also, step beyond this hearing, you also have members who are already doing town halls around this issue to educate individuals around how they can follow up to make sure there are new criteria that SNAP is requiring individuals so they can remain on the rolls to receive their SNAP benefits are educated properly. So with that being said, I'll turn it over to you, Madam Chair.
Thank you. Thank you, Council President. I want to recognize that we have Council Member Jamie Gauthier from the 3rd District joining us as well. And now I'm going to recognize myself for some opening remarks. Once again, good morning. As the chair of this committee, I take this issue very seriously. I want to thank all of you for being here this morning. And let's be clear about why we are here. This crisis is man-made. It stems from choices by the Trump administration, choices that triggered layoffs, destabilized basic public services, and now propose only partial SNAP benefits while holding the country hostage to a government shutdown that threatens to drive healthcare premiums even higher. This is not fiscal discipline. This is cruelty by design. Let me just say it again, cruelty by design. And families in Philadelphia are paying the price. SNAP is not a luxury. As you heard, it is a lifeline for nearly 500,000 of our neighbors. Mothers now forced to decide who can eat and who cannot. Seniors, people with disabilities, veterans, and working people holding 2-3 jobs who still can't outrun the cost of living. These cuts push seniors to ration groceries, and those with disabilities to choose between food and medicine, and squeeze the very veterans who have already sacrificed for our country. In addition to being the chair of this committee, I'm also part of the Food and Nutrition Security Task Force, and we have been working to address this issue, identifying not just immediate relief for hungry families, but also long-term solutions like the Council President mentioned. Even with federal and state support, there are still far too many Philadelphians who are food insecure, and I'm committed to working with Council President and my colleagues in Council and the task force members to advance policies that will prove to be durable and sustainable. I also want to take a moment to thank Mayor Sherelle Parker for meeting the immediate moment in a short period of time. She was able to take swift action and coordinate with city agencies and community partners in addressing this unfortunate crisis in a responsible manner. The shutdown chaos does not stop at the grocery line. It ripples through healthcare, delayed coverage, higher costs, worse outcomes, and by undermining SNAP-Ed, the same decision makers stripped away prevention and education, the tools that help families stretch dollars and stay healthy. This is wasteful, short-sighted, and dangerous. Hunger has no place in a city as strong as ours, and we will not normalize it. And thank you, and we will begin our proceedings. Before we ask for the panel, I want to yield to my council members, anybody who might have some comments to make. Okay. I recognize Council Member O'Rourke for some comments.
Thank you, Madam Chair. Appreciate that. Good morning to my colleagues, our guests in the chamber today, and the listening public. Thank you for joining us, for tuning in, and also thanks to those who will be watching this back later today, next week, in the months to come. I'm sure it'll be a point of interest in the coming days, weeks, and months. Like access to clear water and clear air, safe shelter and care, access to food is something that the richest nation in recorded history ought to be able to ensure. As we say, you don't judge the greatness of a nation by how the richest and well-off are doing, but by those who are in most need. And it says something wicked, I dare say twisted, about the state of that nation when it does not. And while we will identify and indict the clear cause of this SNAP crisis, I do want to admit that I sit here a bit frustrated with our timing this morning. Because as the council president said, hunger is not a new concern or issue, certainly in the municipality of Philadelphia. And also, on the day of the president's swearing in, day one, he was signing executive orders based on Project 2025 directives. Day one. By the end of his first month, it was clear that the goals laid out in that document were a large part of his governing strategy, if you want to call it that. And the plan for SNAP was laid out there and in the big, goofy-looking bill that they passed in July. On this and many other fronts, we were plainly told what to expect. And I don't know if we can say, and I'm talking about we as electeds here and abroad, actually heeded those warnings adequately. Our reach is limited. Our capacity strained when compared to higher levels of government. We can only be prepared for so much. But during the crafting of our city's budget this past spring, my very first question was focused on how we were planning to safeguard Philadelphia from a Trump administration, and I was not alone in this body in sharing my concerns on that front. Business as usual will not work. And I implore everyone here and my colleagues to consider how our budget decisions, that's the thing that we have control over, are showing up in this moment, and to have the foresight to think about the next several years to come and how we navigate that process. We've got to invest in our city services. We've got to invest in our people. And I fear that in too many ways, the priorities we set during our spring budget cycle ignored our reality. We are defunding ourselves over crises that we could have seen coming and putting families at risk as a result. I'm grateful that we had a surplus this year to address this crisis, but we have to be honest with ourselves. That surplus does exist because we're struggling to fill city positions that are more important than ever. This approach is just not sustainable because we know more crises will come, certainly under this would-be king. Still, I have plenty of faith that we can and will respond capably. And I'm grateful for the efforts of everyone here to be a part of that process. I have faith because, frankly, I trust in a man who took 2 fish, 5 loaves of bread and made that more than enough. Oh yeah, turned the water into wine. Took nutrients and made it a good time. Do I have a witness in the room? I also believe that we don't need to bank on a miracle to keep our people fed, right? God will not do for us what God has endowed for us to do for ourselves. And I think that we can do and we will do much better. I'll close just by asking for a quick show of hands. If you or someone you love has ever relied on SNAP for nutritional assistance, could you just raise your hand real quick? Jesus. When the impact of some scheme in Washington is so broad, so immediate, so evident ahead of time, we got to be better prepared. Proper preparation prevents poor performance. That's what they told me. But thank you for everyone being here, for being a part of the solution. I believe a better day is upon us, and I think we're going to be a part of making that happen. Thank you, Madam Chair.
Thank you, Council Member. I want to recognize Council Member Rulandau.
Thank you, Chair. I just want to take 1 second to, first of all, thank the Council President and the Chair for convening us today, and for all of you being here. This is an essential conversation. Yesterday, as I drove around this city on Election Day, going to polling places, I saw lines for food that I have never seen in my entire life. They wrapped around blocks and blocks and blocks. It was heart-wrenching. So it's only November 5th. We are already seeing the results of this. And what I'm really looking for today here in Philadelphia, the cities of firsts, is that we come up with a real long-term solution to this issue. I thank the mayor, I thank the governor for standing up and putting in some emergency funding, and for all of our food banks and folks who are handing out food. It's so fantastic. But that is not the long-term solution for already overwhelmed and overworked food pantries. SNAP can provide 9 times the amount of meals that food banks can provide. We've got to make sure that we fix this in a way that gives cash to people's pockets, that gives them dignity, that gives them a way of choosing for their families what they need, and that's how we're gonna have Philly thrive. Thank you so much.
Thank you, Councilmember. Are there any other members who would like to offer opening remarks? And I recognize Councilmember Curtis Jones, Jr.
Thank you so much, Madam Chair, and thank you, President, for bringing this worthwhile issue before the body and assembling stakeholders that can do something about it. I came down here because the trickle-down effect in my district is real. Let me first acknowledge Cher, who is in the 4th District, and Phil Abundance, who impacts organizations in my district and for their work going back to the pandemic. I remember seeing a guy that I went to school with, had his grandson with him. His grandson holding on to his 2 fingers tightly as he was down at a food giveaway. And I'm looking, wondering, why is he in the line? When I got to talk to him, he sheepishly, humbly, brokenheartedly said because he got his business was, his workplace was closed down due to the pandemic. And this was the way he was going to feed his grandkid. And I'll never forget that grandson looking up to his grandfather and saying, "It's going to be all right, Grandpa." It broke my heart to see that. But thank you that he was able to take something home to feed him. The second thing, most recently, this weekend, I'm at one of my ShopRites, and a lady who could have been any of our grandmothers had a cart, and the security guards were going through her receipt, taking things out of the cart that she was attempting to steal. In the greatest country in the world, this should not be happening. The third thing that I want to say in closing is it's not just the absence of SNAP, it is also the prices of food. In that same shopping trip, my favorite cereal, yours is Captain Crunch, mine's is Cream of Wheat. $8.65 for a box of Cream of Wheat.
I wasn't fortunate enough to afford cream of wheat. We had grits with sugar.
I get it. I get it. But as we look at these issues, we got to look at shrinkflation.
That's right.
We got to look at how the consumer is getting less and having to pay more. So I'm looking forward to some of the insights that people have. And then one more. We have to change the rules with the school district. There is no way that kids that come, and probably it's one of their only predictable meals for many,
All day.
right? Have to watch food not being eaten and then thrown in the trash. When they have siblings at home that could use those food, that is a waste. On behalf of students all over Philadelphia, ketchup is not a vegetable. Can we get better lunches? And can we find vendors that can provide a more nutritious. I know Philabundance could do a better job than whoever they are in providing that type of food. So I'm looking forward, Mr. President, Madam Chair, to hear some of the solutions to some of these problems. Thank you. Thank you very much.
I just want to say for the record that Philabundance headquarters in the 2nd Councilmanic District in South Philly. Just the record.
Thank you, Council Member, for sharing and humanizing this issue. This is not just dollars and cents and somebody sitting in the White House decimating our loved ones here. When I came to this country, I didn't have any of these benefits. I had to measure my pennies to see what I could afford that day. I didn't have access to all this. And I come from a country that is really poor and have none of these safety nets. So I can tell you how important it is. I come from a place where parents have to watch their children emaciate and die in front of their eyes. When I came here and I saw how government steps up in times of need and creates these safety nets, it is critical that we send this message to the rest of the globe that in hard times we can step up. That's the role of government in our most vulnerable times, to step up, not this cruelty campaign to deny us the very basic human need of nutrition and food, right? So with that, Mr. Sham, will you please call the first panel to testify on this bill?
Renee Garcia, City Solicitor of the City of Philadelphia. Dr. Palak Raval Nelson, Health Commissioner for the Department of Public Health, and Orlando Rendon, Executive Director of Community Empowerment and Opportunity at the City of Philadelphia.
Good morning. Noting for the record that Ms. Renee Garcia will not be taking any questions. Am I correct?
I can take questions about, there are a lot of topics covered. I can take questions about what I'm going to speak about, for sure.
We were told you would not. Okay. Well, we're happy to hear you will take questions. Okay. Please state your name for the record and proceed with your testimony.
Yes, Renee Garcia, City Solicitor. Good morning, Madam Chair. Good morning, Council President. Good morning, members. Good morning, guests. And I'll echo my gratitude for everybody who has come together to meet this moment, and for everybody who met the moment yesterday and will meet the moment tomorrow. Before we go into the details of the program, we thought it'd be helpful for me to do an overview of the federal litigation, because if you've been following in the news, things change every 2 hours, and it's very hard to follow what is going on. So I'll do a deep overview, and then we'll move on to the details. So there's two cases.
Ms. Garcia, just
Yes.
real quick, just for the record,
Sure.
because inquiring members would like to know also, because you are our lawyer, just wanted just clarity on, just give us the framework on what you want to answer and the reason why you prefer not to answer, as opposed to folks just thinking I don't want to answer, and that's not the case. So just put it in the context.
Sure.
Because it's a legal case going on.
So, as you know, that there is, our conversations are privileged. My conversations with the administration are privileged. So I am giving an overview of public information regarding the litigation. But if there are questions about legal strategy, those are questions I do not want to answer in the public, and we can have off-site conversations about that. I wouldn't want to waive privilege.
We just wanted to put that in the context
Yes.
so we would know, and then the wider public would know that no one's hiding anything. It's just around legal strategy and not putting us in a predicament down the line.
Exactly. Thank you for the clarification.
Thank you.
So with the publicly available knowledge, there are two cases, one in the District of Massachusetts and one in Rhode Island. Both of those cases have been moving very rapidly over the last week, which is creating the confusion in the press on what is being paid and what is not being paid. The cases revolve around a contingency fund for SNAP benefits that was set up in 2024. That contingency fund only had $6 billion in it. So $6 billion, whereas the monthly need as a nation is $8.62 billion. So the contingency fund was not enough to even cover 1 month of benefits. Over the course of Friday and Saturday, both judges issued orders, emergency orders, advising that the government would have a choice whether they used that contingency fund and did a partial payment for November, or they tapped other funds and did a full payment in November. We learned on Monday that they elected to do a partial payment for November, meaning that they would not be tapping other funds to cover all of November's benefits. Again, there's only $6 billion. There's a great, much more need for that. Here's how the math breaks down on that $6 billion. 4.65 will go for SNAP benefits for November. 150 million will go to a nutritional block grant, the NAP, and I can see you all writing. I can also submit this later on for Puerto Rico and Samoa, and then there's $450 million for administrative support. Now, those three numbers did not add up to 6. It's because they tapped in October $750 million from this fund already for that block grant and for administrative fees. So 4.65 billion going out is about half of what the states need to fulfill their benefits. Again, they elected not to take other funding from the USDA, which would have affected school lunch programs. They're very public about that. PA gets $366 million a month. We don't know the exact number that's going to come, but assume it's about half. Now, yesterday there was another case development in Rhode Island. The plaintiffs in that case, which are various nonprofits in a couple of cities, filed for emergency relief, saying that the partial payment was not going to be enough. That hearing is tomorrow. So again, things are developing very rapidly. What we don't know is, okay, the government is at least going to send half of this money. How long is it going to take to get to people's EBT cards? In Pennsylvania, the money actually goes to a third party that loads it onto the cards. We do not know the details of that. Everybody's following that very closely, but I want to say that kind of the upshot is Pennsylvania's looking at about half what they would normally get for the month. That is the legal overview. I can answer any questions about the record. They did, and I can leave this document with you, they did this morning publish the chart of how much people would get per month based on their household. So a household of 1 would get $149, a household of 8 would get $894, and so on and so forth. So they did publish that. They have not published the full number for each state.
So thank you for that testimony. I just wanted to ask a question about clarification about loading the EBT cards. From what I understood, the president has said they will not be loaded, and even the partial, it will be partial, but that loading is contingent on the impasse in the federal government budget to be over. Am I correct? Or?
He did say that, and then it was walked back yesterday.
Okay. So
as far as we know this morning, the
Yes.
payment will be made. We do not know the details on when it's made and ultimately when it gets onto the EBT cards.
yeah, we just need to be very clear for our constituents to understand this back and forth and when they actually will have their EBT cards loaded. So if we could have a channel for us to be able to share that, that would be really helpful.
Absolutely.
Anybody have more? Yes.
Can I ask one more clarifying question? So this is simply for November with the contingency fund we have now, and is there any plan going forward beyond
There's
November?
nothing for December. This will be completely extinguishing that contingency fund.
One other question about the amount in the contingency fund. Was there a lawsuit about the fact that it was not fully funded, the fact that there was supposed to be more money in the contingency fund?
That I haven't seen. I know there was another case in New York that was then withdrawn. So if you saw that, maybe it was that case. But these two cases are not challenging the 2024 congressional allocation to the fund.
Okay, thank you. We'll go to the next panel member.
Good morning, Orlando Rendon, Executive Director for Community Empowerment and Opportunity. Good morning, Chairperson Ahmad, Vice Chair Losada, and members of City Council. My name is Orlando Rendon, and I am the Executive Director of the Office of Community Empowerment and Opportunity, better known as CEO. Thank you for the opportunity to speak today on resolution number 250936, introduced by Chairperson Ahmad on behalf of Council President Johnson. According to the national organization Feeding America, in 2023, 17.6% of all Philadelphia residents were, quote unquote, food insecure. For children, the numbers are even worse. In 2023, 30%, or 1 in 3 children, were food insecure. Additionally, according to a 2022 School District of Philadelphia report on household food insecurity, 27% of students reported not having enough food at home in the past 30 days, and 20% of families reported facing food insecurity. Nearly 500,000 Philadelphians depend on the federally funded Supplemental Nutrition Assistance Program, also known as SNAP, to put the food on the table every day. Simply put, SNAP is a lifeline for Philadelphians. SNAP is a government society safety net and was supplemented by the incredible work of the nonprofit sector. Its impact dwarfs that of the nonprofit sector. To put things in perspective, for every 1 meal provided by the Charitable Food Network, SNAP provides 9 meals. SNAP beneficiaries are Philadelphians of all ages and needs, including children, seniors, people with disabilities, and veterans. In September of 2025, over $96.2 million in SNAP payments were made to Philadelphians. As you're all aware, due to the federal budget stalemate, SNAP benefits were not distributed to the states in the time to make the November 1st payments to Pennsylvanians. As a result, for the first time in the SNAP program's history, the lifeline has been paused, and many Philadelphians are facing the devastating prospect of not having enough food. After 2 court rulings requiring the USDA to release SNAP funds, we learned that only partial benefits will be distributed in November. Even when the funds are released, we anticipate it will take around 10 business days for payments to be loaded onto people's cards. Compounding the financial stress felt by Philadelphians, because of the federal shutdown, many federal employees are facing a future of weeks without paychecks. I am proud to say that the Park administration has stepped up to help Philadelphia navigate these uncertain times. We responded in a strategic way that addressed the many needs, challenges facing city residents. With our One Philly SNAP support plan, a coordinated intergovernmental public-private partnership, we made an immediate allocation of $2 million to the city's 2 largest food distribution partners, Philabundance and Share. These 2 organizations can now increase their food distribution exponentially and move more food to the smaller partner organizations that they support. The Health Department, in partnership with the Reinvestment Fund, established the One Philly SNAP Support Grant Program to distribute up to $2 million in individual grants to food security organizations, many of which are small and grassroots that can deliver immediate food assistance. Applications for the first round of distributions close today at 5 p.m. The application can be found on phila.gov/SNAP Support Grant. We plan to distribute funds as soon as Monday, November 10th. My colleague, Dr. Palak Raval Nelson, our Health Commissioner, is here to answer any questions about this grant program today. The total $4 million just described in addition to a $6 million regional food fund established by philanthropic partners to support the region's food banks. Through a donation from Aramark, the Office of Children and Families, and the Mayor's Office of Education, in partnership with Sharing Access and Food Connect, are expanding the One Philly Produce Project to 43 community and extended day, extended year program schools beginning next week. We expect to distribute more than 300,000 pounds of fresh produce this school year. We launched a citywide public education campaign directing residents to city's Food and Meal Finder, where they can locate free groceries, meals, and support accessing public benefits. The website, phila.gov/food, is in multiple languages and is kept up to date on a regular basis. We also reallocated $1 million in funds at the Philadelphia Department of Human Services to support some of the most vulnerable families with food assistance. Families receiving prevention, child welfare, juvenile justice services are eligible to receive this additional support, which can be accessed by contacting their case managers. Finally, on Monday, November 3rd, Mayor Parker hosted a convening of approximately 100 of Philadelphia's small and large food aid nonprofit leaders. At this meeting, providers were briefed on the city's response to the SNAP crisis, and information was shared about the city's food finder and the grant support program. We recognize that the Philadelphians facing critical times due to the lack of food and steady pay also need additional support. For this reason, the Division of Housing and Community Development and the Department of Planning and Development earmarked $1.5 million in emergency rental assistance for furloughed federal workers at risk of eviction. The Revenue Department also established a temporary payment deferral program for furloughed federal employees who are city residents, covering water bills, real estate tax installment plans, and owner-occupied payment agreements, with no late fees or penalties while federal pay is disrupted. The Commerce Department, through the Merchants Fund, has allocated $500,000 to an emergency relief grant that will offer financial relief to small food retailers, corner stores, and community grocers that have suffered revenue losses due to disruptions in federal SNAP EBT benefit processing. As you can see, this is an all-hands-on-deck approach to addressing this crisis. In addition to all the departments mentioned above, we are ensuring that our water department supports those who may be struggling with one-time payment of bills. We are also working with external partners such as PECO and PGW, who are providing similar supports to their customers. All folks need to do is call and ask for help. CEO's Benephili Centers are also available for Philadelphians that need to help navigate new work requirements for SNAP that recently took effect, to apply for or renew their SNAP benefits, as well as apply for help with utilities, property taxes, medical assistance, and more. Residents can call Benephili Helpline at Clarify at 1-800-994-5537 to connect it to a Benephili specialist. Staff at Neighborhood Community Action Centers have also been trained on the new changes that SNAP recipients need to understand and connect residents to resources. We are appreciative to City Council for holding this hearing and to Council President for his ongoing commitment to this issue, even before SNAP cuts. With his Food and Nutrition Security Task Force, even when SNAP is fully funded and people are receiving full benefits, there will still be many Philadelphians facing daily food security issues. For this reason, we need to continue to work together in partnership. Before I conclude, I want to reiterate that the Philadelphians who need access to free food should go to phila.gov/food, and we thank you for the opportunity to testify. Representatives from every department are here and available to answer any questions that you may have. Thank you.
Did you have a question? Okay. We'll take Dr. Avald's testimony, and then we'll ask some questions. Thank you.
Good morning. My name is Dr. Palak Ravel Nelson. I'm the Health Commissioner. I do not have formal testimony, just answers to questions.
Thank you. So they're going to answer questions. Did you want to go first?
Yeah. Thank you, Orlando, for your testimony and also your leadership around this issue. I just had a couple brief questions regarding the One Philly SNAP support plan. Give me an idea regarding the Regional Food Fund, the $6 million, how we're going about the distribution of those funds. Are they direct payments or is there a grant process?
I'm going to defer that to Dr. Palak to respond.
The regional fund?
Yes.
Or are you?
The Regional Food Fund, the $6 million?
I'm not sure that we're distributing that.
No, I think that the administration had a response for that to
So
do.
we've been allocated, the health department has been allocated $2 million. And Regarding that, we developed a very simplified grant application, and those applications were made available as of Monday. We have 1,177 people that have already applied. The applications close tomorrow. And we have 3,832 requests for application and people filling them out in different phases.
All right, so I don't be confusing. So I know there's a total of 4 million, so I'm very aware
Correct.
of that part. I was part of that conversation. The 2 million to the two largest food bank organizations, which is Philabundance and Share. Then there's the 2 million of grants for organizations can apply for $5,000 to $50,000. So I'm familiar with that for.
Got
But
it.
also, the announcement, there's a total of $4 million investment, correct? $1 million from the governor, right? How much is the philanthropic community contributing to this process? And what are those organizations, and how are those funds being distributed? Can somebody clarify that part?
Sure, I can, go ahead. I can let Rob DeBoe come up and answer that question.
Hey, Rob, how are you?
Hey, how are you?
Doing pretty good.
So the food distribution money is really in 3 buckets, right? There's the 4 million coming from the city,
Yes.
and we are handling how that's distributed in a way that Dr. Pollack went through. Then there's 6 million coming from philanthropy,
Yes.
and they are managing that. So that's not coming through us.
Okay.
And then there's the $1 million from the state that the
So
state.
that 6 million, I guess the question is, how do organizations apply for the 6 million from the philanthropic communities that's totally separate from the city of Philadelphia? And because they're a partnership with the philanthropic community and the city of Philadelphia, wouldn't we get that information so we can provide to our council members and they will provide to their constituents to apply for the 6 million beyond our investment?
And we will work with philanthropy to get that information to you so you know how to
Okay,
work with your
so at
constituents.
this moment, there's a commitment, but in terms of the actual program rollout from the philanthropic community hasn't been done as of yet?
I think that's correct.
Yes, that's correct. I believe we can get the information from the philanthropic community to get you the details in terms of how that will be
Okay.
dispersed and managed.
And that philanthropic funding will come through the Philadelphia Fund? Is that what I thought I heard you just say, with clarity?
No, it's coming through philanthropy. They
Okay.
are managing that.
So it's just separate from that. Okay. Just wanted to get some clarity on that. Because we are working under sense of urgency. And so if the private sector can do what they can do to ramp up their level of participation so we can tap down the $6 million for the constituencies, I think that would be great. How are we going about the metrics in terms of just tracking and making sure that the dollars and support or resources are going to the most vulnerable population that needs support here in the city of Philadelphia?
Sure, and I can speak to the 2 million, as you mentioned, Council President. The other 2 million went to Share and Philabundance. We are receiving the applications from small organizations. We have a rubric set aside to ensure that they can serve food safely and that they have the capacity to provide food immediately. So we've been very direct. The application deadline ends at 5 p.m. today. The reviews will begin immediately tomorrow morning, and there's a set rubric to ensure healthy, safe food, but also that the organization has the capacity to provide it.
And just last, before I turn over to my colleagues to ask a couple questions.
Just add one thing on that. And
Yes.
the grant agreements that we'll enter will require regular reporting on the amount of food being distributed and where it's being
I
distributed.
think those metrics would be good just
Yes.
for us, just as a city overall, to show
Yes.
the level of investment on our end, but also the social impact as a result of the work that we're doing.
Yes.
I want to go back to the philanthropic component. And so in the chart that I had, it just says philanthropic support, then it says 6 million. are we able to clarify what that $6 million means? Is it $6 million to be distributed to organizations? Because when it says support, that could be staff, that can be free consultation, and I just want to get clarity on that part as well.
Yeah, and we'll work with philanthropy to get you a written follow-up on all of that.
Okay.
So that you'll know the whole process and how
All
to
right.
do it.
Orlando, give me an idea of, and again, we've been dealing with this crisis prior to today, right? And we knew that the changing of the criteria was coming down the pipe from Washington, D.C. What have we been doing regarding the new rules and requirements for SNAP? And can you clarify those, some of those rules and requirements?
I'm glad you brought that up because I know we're dealing with the immediate trauma and crisis in terms of getting food to people based on the suspension of benefits. But even if those benefits were fulfilled today and you wait with the lag in terms of getting the money into people's pockets in order to get food, we still have to discuss in terms of the new regulations that have been posed by the federal government in terms of keeping your eligibility. And there's a number of requirements that have been imposed in terms of working that could affect up to 65% of our folks receiving SNAP benefits in the city. We have been convening with a lot of work groups to talk about and how to strategize how to do this, creating strategic and educational campaigns to ensure that existing benefits as we have with the Benefili program, raising their capacity to make sure that we can get folks onto this for awareness, because there's a number of people who qualify for exemptions. It's just to make sure if they're not automatic, if you're like above 65 or below 18, you're okay, you would be exempt. But there's a lot of people in between. And there's a lot of different criteria that people may not be aware of that we need to educate, do outreach, send texting saying, if you think you're having a problem, come to us so we can help you fill out the appropriate paperwork. If there's a medical exemption of some sorts, we want to make sure that you're covered so that you don't lose your benefits.
How are we getting the word out regarding, like I know members of the council are doing town halls, right? And obviously we would love to be in partnership with you as well. Are we doing town halls? Are we doing social media campaigns saying, hey, or radio ads saying, hey, criteria is going to be changing? Are we doing anything from an outreach standpoint that you can elaborate on? And then also specifically around immigrants. If I'm correct, they aren't, under this new policy, eligible for SNAP benefits, which I know for sure is going to impact a significant population of all of our constituencies. Could you elaborate on that? And if we have a plan to help immigrants who may no longer be under this policy, who aren't no longer eligible under this policy, to get food in their hands?
So I'm going to ask upon my Deputy Executive Director, Beth McConnell, who can speak to in terms of the strategy. A lot of the things that you mentioned are included in terms of town halls and joining with City Council to make sure we get that word out. But she can speak to also in terms of the populations with the immigrants and the plan in terms of those who are exempt, who are still complying, and those who don't have a chance, but what do we do in terms of making sure that they're covered as well?
Good morning, Council President. Beth McConnell, Deputy Executive Director of Policy and Programs at CEO. So in addition to, starting in August, CEO has been convening leaders across the administration and multiple departments to plan for the new work requirements, some of which went into effect September 1st and others November 1st. We've been collaborating weekly. We've been meeting routinely with PADHS. They've been great partners. Secretary Cush and her team have been great partners on this. In addition to the kind of traditional outreach that we've been doing, there's social media toolkits, there's e-blasts, there's flyers, all that stuff. One of the other things that we're really working very hard on is much more targeted outreach using data. We have a data sharing agreement that the Parker administration signed with PADHS this summer that gives us actually a list of all the households in Philadelphia that have SNAP and TANF, and that allows us to do targeted text-based outreach, some mailing, and we might be able to do some also targeted telephone calls to those individuals to say, hey, you got to know about this, and here are the resources to help you navigate it. We hope to launch that text-based outreach in the next couple of weeks. We also have a partnership with the School District of Philadelphia, that's also sharing information about school district families that we can do targeted outreach with. And we'll be directing a lot of them to a variety of resources in addition to the Philly Food Finder, but also the Benephili program for folks that need help navigating the new work requirements, knowing whether they're affected, and getting in any paperwork that they need to get in.
Thank you very much, and thank you for your leadership. I just want to clarify, just for the record, and all those are paying attention around this, on this particular hearing, under the Budget Reconciliation Bill, which is the one big ugly bill, thank you, Councilmember Jamie Gauthier, as of September 1st, 2025, adults ages 18 to 54 without a dependent under 18 must prove they work or volunteer at least 20 hours per week to maintain their SNAP benefits. Those who cannot meet this requirement may only receive SNAP for 3 months within a 3-year period, unless they qualify for an exemption. As of November 1st, 2025, work requirements have expanded even further, now applying to adults up to age 64 and narrowing eligibility for exemptions. Adults without a dependent child under the age of 14 are now subject to these rules, and veterans and current or former foster youth ages to 18 to 24 are no longer exempt. And for me, that shows that a specific population of individuals will be severely impacted. Are we doing anything as a city from the employment, job training, or volunteer opportunities perspective to help individuals meet the 20-hour requirement?
I'll let you answer, and then I'll.
Yeah, we've been in collaboration with Philadelphia Works to discuss ways that opportunities for employment and training can be made available to more Philadelphians so that they can meet those needs. As you know, the state budget impasse is also a complicating factor in all of this and has affected workforce development providers as well, so it's something that we're paying close attention to. We also know that folks can meet the obligations through a combination of actual work and community service opportunities, as you mentioned, Council President. So we've been talking also to PADHS and a number of community service providers about how people could kind of piece these things together. There's been some discussion about some platforms and tools that could be used to connect people that have volunteer opportunities with people that are looking for them. That is kind of ongoing and in development. This is all happening very quickly, as you know. But yes, I think it's very important that those opportunities be available to folks. But it's really not very sustainable long term, right? And a lot of people are, even if they're able to meet some of those work requirements in the first couple of months or even the first year, to be able to continue that over long term is going to be a real challenge. And so that's something I think we have to pay attention to, is how many Philadelphians are losing SNAP either permanently or until the next opportunity to reapply as a result of being unable to meet the work or community service opportunities.
And this is, if I may, and this is where we're working with our partners to get the outreach, as you discussed, all the exemptions that you described. We've been working with our neighborhood community action centers that are all over the city to make sure that particular staff is trained for folks to come in to be able to know where the resources are, where the hiccups are, and to inform these individuals where that lies. Working with CCME as well for workforce development to make sure that there's opportunities that perhaps come into the city that could help and assist for those requirements so that they don't lose their eligibility. So those are things we have been pushing and having conversations with as well.
And last part, is it that immigrants are no longer eligible, period, or they can be eligible to meet the requirement? Could you clarify that part of the new requirement?
I wasn't sure about the immigrants right now.
Yeah, so there are a number of folks who have lawful status in the United States but are not U.S. citizens who have previously been eligible for SNAP that will lose their eligibility permanently. I do want to, I think, refer maybe to some of our legal services organizations that have a little bit more expertise on that to answer those questions than me. But I think it's something very concerning that they will permanently lose. There's some new guidance that came out from the Food and Nutrition Service last week, I think it was, that I think there's some questions about that guidance that still need to be answered.
Yes.
But yes, there are a number of folks that will absolutely lose.
And I do see we have Community Legal Services on the next panel, so I'll save that question for clarification. I yield, Madam Chair.
Thank you, Council President. I want to acknowledge the presence of Councilmember Cindy Bass, who joined us. And before I hand over the mic to my colleague, Ketsi Lozada, I have a quick question. To be clear, there is no comparable method of people getting resources directly. It has to go through either the food, share or Philabundance. There's no direct alternate way of people to get EBT-like resources directly to them so they can go buy stuff at a grocery store. They have to go through these other agencies. I just want to be clear so we can tell our constituents.
Sure. They do have to go through the grant process or what has been put in place. There's not a mechanism for direct payment to folks.
So that's a whole, education process because people are not used to this. And so we really need to ramp that up, and we would love to see what is happening to make sure that you mentioned the data analysis and we know who they are, right? We should be able to do it. 2 weeks is a little long for us to be able to mobilize that. I would love to see that we are using our data that already identifies which households are SNAP recipients to immediately tell them, this is how you have to go about feeding yourself, right? That's one. And two, I had a question about DHS, and I heard that DHS was going to be giving some resources. How is that going to happen? Because is that a direct resource allocation, or do they also have to go through, the other organizations?
So good morning, I'm Kimberly Ali. I'm the Commissioner for the Philadelphia Department of Human Services. So thank you for that question, Dr. Ahmad. In terms of DHS, they will receive direct allocation, and how they will do that. When I talk about DHS, I'm talking about families who are receiving prevention services through DHS, child welfare families who are receiving services through child welfare, as well as young people who are receiving services through our Juvenile Justice Services Center. And so I have authorized the providers to purchase gift cards to grocery stores because we did not want to overwhelm the food banks, the pantries, and so that authorization occurred on last Friday. We already have some money that's already on the ground so that we can make sure that those gift cards are in the hands of the families who need it the most.
Well, thank you. Can we take this gift card approach to the whole system? Because that would, well, listen, I mean, we're doing it in one sector for one group of people who are already engaged with DHS. It seems to me the least amount of admin overhead if we already know who are the SNAP recipients, and we just send them the gift cards, whether they're DHS impacted or otherwise. That would be so much easier for the families to utilize. So I would highly recommend we look at why don't we do this direct service? Because that was happening already with EBT cards. We're just replacing it with gift cards from the city for these resources. So I would love to get a response from you. Maybe not, you need to go back and talk about it, but can we mobilize like ASAP gift cards that we already know how to do, just amplify what Commissioner Ali is doing and do it to the rest of our community?
So we'll take that back for consideration.
Okay, thank you.
All right.
I yield the floor to, sorry.
No, hold on. Let's put a pin there.
Yeah.
Because that's DHS doing it, so Kim, this really is out of your wheelhouse, but I think that is a realistic conversation to have with the administration. Orlando, since I know you deal with the Benefit Bank, and also we have a finance director over there as well. With a city of a $7 billion budget, surely we can figure out strategies and ways to really meet this moment in time in history. And so we'll continue having this conversation as we move forward. But it's not new, direct payments. And I think the city had a program under the Promise Initiative where we were doing direct payments before, and at this particular point in time, that does allow individuals who don't want to go to a food bank, right, the dignity to also work going to rather ShopRite or Sprouts or any other store to purchase food, to address it from a variety of different ways. But how much are you authorizing?
So we allocated $1 million.
All right, well, thank you, Council President. We'll yield the floor to Councilmember Quetzil Lozada.
Thank you, Madam Chair. I just want to follow up on the line of questioning that Council President had around outreach and information. And I heard what you all are saying, but in neighborhoods or in communities where there is limited digital literacy and internet access, what supports are being expanded to be able to ensure that people are getting connected, especially if we're expecting them to go find their nearest pantry, upload documentation, fill out applications. Are those individuals that you all are preparing in all of these access centers, are they culturally competent? Do they speak multiple languages? Are there going to be an increase? Are you going to increase staffing in those spaces given what we're expecting could potentially be happening?
Absolutely. So as mentioned before with the Neighborhood Community Action Centers, they've been trained in order in terms of what all the resources are. I believe the staff that are established in particular communities are culturally competent where they are. We will supplement that and just with CEO in terms of outreach with our own teams and different mechanisms and methods to do that, be it text, but in different languages to folks that are targeted with information we may get. So we do have a plan in terms of try to outreach and make sure we touch everyone as possible to ensure that they have the accurate information to make sure to get the resources that are needed.
Thank you. And then one of the questions that we received in one of our community meetings was related to DHS, and the question or the concerns for some of the parents was, you know, I may be put in a situation where I'm not going to be able to feed my children the way that is expected. My neighbor, the school, someone may call DHS on me. Is DHS prepared to respond to those types of situations where parents are put in this position that is really not an abusive situation intentionally, but as a result of what is happening around us?
Yes, thank you for that question. So absolutely. So let me first just set some context around DHS. Our mission is to stabilize family and support families in their most difficult times. So food insecurity is one of those. And so I want to also dispel a myth and give you a sense of the data around it. When I look at the last 4 years, we received only 199 reports into our DHS hotline because of failure to provide adequate nutrition. To give you a sense, we receive about 35,000 calls a year into the DHS hotline, so very, very few calls. However, we'll continue to track that. What I will say is that if a family is in need of some supportive services, they can call DHS at 215-683, the number 4-DHS. So that's 215-683, the number 4-DHS, and we will support them.
Thank you for that. And finally, you know, my family was put in a situation where my dad went to work and found that the factory was shut down, and we were a one-income family. And we had to go to public assistance, and my mom refused. And so that forced my dad to be able to take care of a family of 5, to be able to put food on the table. And I saw how difficult it was for my dad and other men to be put in a situation where they had to go stand in line in order to be able to provide for their families. And so looking at options or situations where we can make it a more direct access as opposed to people having to go stand in line and people having to go feel like they are begging in order to provide for their families is extremely important. And we know that. We know our cultures, we know our families. And so anything that we can do to give folks more direct access and to eliminate all of these barriers that sometimes we put into place that are really not necessary are extremely important. So I encourage all of us to figure out what those options are. so that we can make sure people do not go hungry in our communities. Thank you.
Thank you, Councilmember Lozada. To reemphasize, we need direct payments. I will yield the floor to Councilmember Cindy Beth. You just told me. Yeah.
I thank my colleague okay, thank you. Thank you, Councilwoman. Let me ask you a question. Anybody in the room raised on food stamps, raise your hand, if you're willing to, right? So, you know, for those of us, listen, it's the saying, if you know, then you know. The stamps are very important. Most of the time, people run out of food stamps before they run out a month. And it's, you know, even before we hit this moment, it just wasn't enough. Yesterday, I happened to be driving down Broad Street in my district, and I came across the giveaway that Saudia Schuler was doing at her location around Broad and Pike near Erie. And the line was wrapped around the entire city block. And probably then some. I don't know what was happening on the other side of the line, how far it was going. She served about 4,000 families yesterday. And that's families, so it's more than one person. Those are moms, dads, children, grandmoms, aunts, uncles, it's everybody. And so I say all that to say that we're at this moment, but it's so critically important that we have a plan. I'm praying that we get out of this mess sooner rather than later, because it's just so real. But getting out of it isn't enough, because what we had before wasn't enough. I know that you all know this. I know I'm preaching to the choir, but I really just wanted to emphasize, I don't have a question, I really just wanted to emphasize the importance of making sure that food assistance goes so much further than where it was pre-government shutdown. It's got to go further. We've got to be the drivers of it. We need to make sure that everyone in the city of Philadelphia has access at all times, regardless of what's happening on a federal or state level, or even a city level, regardless of what's happening. How do we get there? Mobilizing all of the resources that we know that we have available. So I know that, listen, you've got a tall order right now, but I'm just thinking, after this crisis, because again, I'm praying that we're able to wrap this up sooner rather than later. Although we don't see it in sight, listen, we're very hopeful. But after this is over, what happens to food and security in the city of Philadelphia, which was already unacceptable? So we were giving out food in my district during the pandemic. We started the day of the government shutdown here in the city of Philadelphia, which was like March 13th of 2020. And that was a Friday, because I remember it was Friday the 13th. And then that following Monday, we were at Panatti Playground making peanut butter and jelly sandwiches. And, just doing whatever, because people had no idea where to turn, what the money situation was going to look like. We just need to stay there in that mode of trying to figure out how people are going to eat, no matter what is happening. So I thank you for your service. I thank you for all of the hard work. I know each of you and the work that you do, but I just really want to implore upon you to think beyond where we are right now, because it wasn't working before. It's certainly not working now. And so how are we going to fix that? Thank you. Thank you, Madam Chair.
Thank you, Councilmember Bass. Councilmember Gautier, finally your chance.
Councilmember Gautier, can I just make one brief comment? This is for the Health Commissioner. Just wanted to clarify, Dr. Nelson, regarding the philanthropic support. It's called the 6 Million Regional Food Fund. Just wanted to clarify that for the record. This is a part of the press release given out by the mayor. I just wanted to make sure I had my facts straight, that there is a $6 billion regional food fund established by philanthropic partners to support regional food banks. And so I just wanted to state that for the record, because when I mentioned it, it was like, What are you talking about? So that's
No,
why I
no,
clarify
no,
that.
understood,
Okay.
council member, and yes, and as our finance director, Mr. DeBoe, explained, that's being handled directly through the philanthropic organizations. We'll make sure we get you additional
Yeah, just wanted to
information.
clarify that.
I know,
That's all.
I know. I was ready for my stuff with all my
Yes.
numbers, because
You
they're
said, "I
coming
gotta
in
do it
every
then."
minute. Applications are coming in every minute, sir, so
Yes.
I was ready with my numbers.
Yes, thank you very much.
You're welcome.
Recognize Councilmember Gautier, waiting patiently.
Thank you, Madam Chair. Thank you, Council, for hosting this really important, critical conversation. Thank you to the gracious members of the Public Health Committee for allowing me to ask questions. This is so important, and I'm really proud of all of us for coming together in the way that we have to make sure that we're stepping into the gap for people. And I commend the Parker administration for the resources that you put in place pretty quickly and how comprehensive they are. And I also wanted to just acknowledge all of the organizations doing this hard work, Share, Philabundance, the Food Trust, many, many others across the city, because we all know that this was a need before these recent happenings. Wanted to remind people in my district that my office hosts a food giveaway every Thursday at noon at 52nd and Cedar at our district office. But of course, agree with my colleague that we can't rely on food giveaways. So I'm happy that we're going about this by many other methods. I don't know if this is a mechanism to get direct payments to people, but just wanted to remind the members of the committee and everyone present that we do have the PHL Housing Plus program that we use to provide people with money that they pay their rent with, as well as a host of other needs. We just, I believe, made a commitment to continue that program based on how well it has done in keeping people in their homes. So I liked the sort of gift card idea, but just wanted to throw that out there as another means of getting direct payments to folks that we already have in place. I wanted to just go back to this issue of outreach. I think that's going to be incredibly important, particularly around helping people to understand the new eligibility requirements and what they need to do to be in compliance. I was heartened to hear us say that we're going to have a texting program. We're going to be reaching out to people directly. I think I heard us say that we'll be helping people at the community action centers as well as at the Benephilly sites. But I just wanted to hear a little bit more detail there. Beth said that she thought that we'd be able to have sort of that outreach system launched in a few weeks. I wanted to ask how confident we are in that sort of time span, because it's very critical. I also wanted to ask and wanted to hear specifically, how are we expanding staff at the Benephilly sites and at the community action centers to really be able to shepherd people through this process? Because I think folks will not just need a text, they're probably going to need a level of hand-holding to determine how they continue to get served. And I know that we've done this at other points in the city. I'll just give a quick example. I had my first son at 25. I don't know what list I was on from the city, but I would get a call from the health department every few months to say if I had, gotten vaccines for my son. And I thought it was annoying at the time, but I still got that call every few months as a new mom to just make sure that I was on track, because obviously that was an important public health issue. SNAP is what we're dealing with now, but I think we all probably agree that the people targeted by these policies, Black people, brown people, immigrants, are going to continue to get beaten down by this administration. And so I foresee that we're not just going to need this sort of case management help with the SNAP issue, we're probably going to need it for a while. So I just wanted to hear more specifics about how we're resourcing ourselves to really help navigate people through this very tough time.
I'll just say that With Benephilly, we mentioned earlier in terms of the capacity, the one-on-one financial counseling that occurs, we are expanding our partners in terms of making sure that we meet the demand in order to do that. Luckily, we received an award amount from William Penn Foundation to expand on that work, so to get more individuals to go and assist and help to do that. We also have, and I wanted to mention something that Councilwoman Bass mentioned in terms of SNAP is not enough, just as is. But the fact that we are still able to provide over 2,000 benefits that may be eligible that are public for folks, if you qualify for LIHEAP, if you do something with Homestead, you get some utility assistance, that may free up some resources to be able to help offset in terms of trying to do something with food as well. So we are expanding on that as well. As far as we already have some folks on the ground with NCAC, Neighborhood Community Action Centers, that are already knocking on doors with literature and flyers to make sure that people understand what the resources are and where to find them and where to reach them. So those are some of the things that we're just doing now to build upon the capacity for moving forward to meet the demand.
That's great. I think I'm asking, and this could be a follow-up, if you can provide specifics about how many people we're bringing on and what we think that will be able to do from the perspective of serving the public.
Certainly.
And then the other question, how are we reasonably certain that we will have this outreach system ready to launch in the next few weeks?
We're working on this. It's already happening. So it's ongoing literally on a day-to-day basis, and it's evolving as we speak.
Thank you so much for all of your work and for being here today.
Thank you.
Thank you, Councilmember Gautier. I yield the floor to Councilmember Ru Landau.
Thank you. I wanted to follow up also on the outreach system. I was really interested in all the years I've worked in the city and with the city, have been always concerned that we weren't sharing enough information to make things go faster. And as the head of the tech committee, I know Beth McConnell said that we're going to start getting some data about all households who have SNAP or TANF from the state, right? And what was the name of that data?
PADHS.
What's that, I'm sorry?
Through PADHS, Pennsylvania
Yes, okay.
DHS, yes.
And in that system, so you're saying that's already started?
That just began. It's something that we've been striving to get for a very long time. We were able to get that agreement, and that's going to come into a key role in terms of targeted outreach for folks once we get that information to be able to say, this is where we're going, this is the people who need it the most, and we can actually get the resources at their door when we can do that.
First of all, that's fantastic. Congratulations. It always seems so simple what we needed, and to actually get it. In that data sharing agreement, are we sharing data back with the state?
Yeah.
So I can confirm that we have received delivery of data from PADHS that is specifically, there's obviously very specific use cases that we can use the data for, and there are things that are not in that agreement. The current agreement allows us to do targeted outreach to help people maintain their SNAP benefits and also help people enroll in SNAP or apply in SNAP that are not currently enrolled. So we'll be using the PADHS data to do targeted outreach for those two purposes. We have been in ongoing conversation with DHS about ways that we could either amend or have a new data sharing agreement to also be able to communicate some data back that we have as a city. For example, we know, people who might have experienced homelessness because they've had an interaction with our homeless system. Could we potentially provide that to PADHS so they could exempt those people who should be exempt, but they don't have that info. Now, again, this is an exploratory conversation. Obviously, the privacy rights of people are paramount. There are multiple reviews from lawyers at PADHS and the City of Philadelphia before any of that can be executed. But I can say we've been having very, very fruitful discussions about that possibility. And I just use the homelessness data as one example. There could be other forms of data. So we're looking forward to continuing those conversations with a sense of urgency, obviously for the moment that we're having now. But we'll be ready to answer your questions, be able to launch that outreach of the data that we already have very soon. Yeah.
That's super helpful. Last question, is there a plan to share the data sets that you have now with other departments in the city?
No, we do, well, no, we don't. I think, let me pause on that question and let us get back to you, because I think the legal agreement, I don't want to misstate what's in the legal agreement, which I don't have right in front of me, but there are limitations on who can get access to that data. They have to be specifically named in the data sharing agreement. So let me just double confirm on that. And
Okay, thank you so much. It was helpful.
Thank you, Councilmember. Before I yield the floor to Councilmember O'Rourke, quick question, clarification. So just going over the numbers one more time. The city of Philadelphia has $4 million for the food bank of people, 2 and 2, that's 4. And then you have $1 million?
No,
So
ma'am.
total of $7 million
Sure.
from the city? I just
Let
want to
me-
be clear.
Let me restate it. So it's a total of $4 million. The $6 million that President Johnson was referring to is from the philanthropic organizations, and
Yeah.
they're handling that on their own.
That's right.
We have $4 million. The total is $7 million for other services as well, but the money towards food, just for food, is $4 million. Share and Philabundance had $1 million each, and then the remaining $2 million was allocated through the health department to provide grants and opportunities for smaller organizations to get the food out the door to people that need it.
So, so that 1 plus 2, 4 plus 3 that you're saying for overhead, what is that for? The
So
3 million?
the remaining dollars, I think Rob can explain that. There's for housing and other things, but.
Okay, those are the direct rent and all of those things that will go through. How will that be dispersed?
So there's $1.5 million in rental assistance.
Yeah?
That will be dispersed through the Office of Planning and Development.
Mhm.
There's the $1 million that the DHS commissioner was talking about. And then there is also $500,000 for businesses that will go through Commerce.
Okay, so that makes up the 3 million,
Yes,
sort of the
exactly.
admin-ish type of work, okay.
Yes.
And then, so philanthropic support 6 million outside of our purview, and the state support the 1 million.
Yes.
How is that coming through us? Is that coming, are they doing this directly? Do we know what they're doing with that?
We can get you details, but I think what they're doing is working with local food distributors.
Also
and the money will
directly,
go through
okay.
there, yes.
So we have a total of 14 million.
Correct.
In this near term.
Yes.
All right, thank you, Council President.
Just for clarity, Rob, so the $1 million that comes from the state,
Yes.
right, is that $1 million coming through our budget?
It is not coming through us. It is going straight to the
So
food
we're
distribution.
basically just saying, because the state is giving $1 million, we're claiming it as a part of being supportive of what's going on in the city of Philadelphia, but it's not a direct contribution to the city of Philadelphia.
We were trying to capture all of the assistance that is coming together. And so we're putting together what we're doing, what philanthropy is doing, what the state is doing.
City of Philadelphia, 7 million.
Correct.
Total,
Of
okay.
the total of 14.
Thank you. Yield the floor to Councilmember Nick O'Rourke.
Thank you, Madam Chair. You have already pointed this out. My apologies. Thank you all for your testimonies and being here today and providing what you've provided. Madam Chair has already kind of spoken to this and pointed this out, hitting it again just now. For my purposes, I want to underline it again for anybody that's watching this back and make sure that we don't miss this moment. Additional investments in food banks, we know that they're critical, right? As you said, Director Rendon, in your testimony, as Member Landau also underlined in her remarks, her opening remarks, I believe, SNAP's scale and impact dwarfs anything that nonprofits can realistically do in this moment. It's super important in my mind. When I got here to council, my first floor speech included, in my dream city, King's vision for a guaranteed basic income would be the reality in the city, so we didn't have to worry about how to get money into people's hands directly. Thank you, Commissioner Ali, for what you all have done at DHS to get cards, proactively thinking about that and mobilizing that. Member Gautier, before she left, mentioned something around Housing Plus. That might be a good idea. Right now, those are all pilot programs, the guaranteed incomes that exist. Hopefully one day we can realize that as a permanent thing. But can you clarify, beyond the million that from DHS, are there any direct aid that's going into the hands of Philadelphians right now beyond that one particular thing?
In the program that we're rolling out, we've mobilized over the last week, is that what you're talking about, or are you talking about more globally in city government?
No, directly in the city government, yes. Is there any, can you point to anything other than what Commissioner Ali, Commissioner Ali has done that reflects direct money into people's hands to go get food now?
Orlando, do you know, or otherwise we should get back to them?
I think we would have to get back to you.
Okay, please do. I think it's, again, this has been spoken to. I'm underlining it because I think it's essential. Member Bass, Member Landau, somebody else. I was out yesterday doing a tour of North Philly, and I saw the line twice the size. I saw on social media, you know, social media is kind of the streets now. It's where you get your information. There are a number of young brothers who are out collecting food, trying to get ahead of this to get actual food into people's hands. The brother broke down in tears when he realized how long the line was. He was hurt that he could not meet the moment. And so I cannot overemphasize how absolutely essential it is for us to be thinking direct money in people's hands to get food in their bellies yesterday. And I think that's the kind of thinking that we need to do in terms of how we mobilize our government in this moment. So I just wanted to underline that.
And let me just say, to emphasize, we understand the urgency of the moment, which is why we mobilized as quickly as we did.
Okay.
And we understand the situation.
Okay, thank you. Well, I want to emphasize it again, that I think it's, thank you for saying that you understand it. It can't be overstated that we need to get that into the hands. I also want to say that I actually appreciate the recognition in your testimony, Mr. Rendon. We recognize that Philadelphians facing critical times due to lack of food and steady pay also need additional support. And for that reason, the Division of Housing and Community Development at the Department of Planning and Development earmarked $1.5 million in emergency rental assistance for furloughed federal workers at risk of eviction. That's wonderful. Can we not be, in the spirit of underlining and emphasizing, even more muscular in our approach? Namely, I believe Mayor Dickens in Atlanta, and damn if we be outdone by the city of Atlanta, actually put a moratorium on evictions. Is that not something that we can be looking at to happen here in the city of Philadelphia in this time?
I'm sure that's something that we can take back and discuss and see where that goes and where that lies, what we're able to do.
We should also mention the deferral that the Revenue Department is doing during the shutdown on amounts that are owed for, for property taxes and water bills. So there's a deferral program for that too.
Okay, thank you for that. And finally, if this crisis lasts for months, God forbid, but if it does, what's the city's current thinking and long-term plans to ensure that residents can still access food? I heard the solicitor mention we don't have any resources. There's no money at least allocated anywhere beyond a month. Where are we at on that?
And to be clear, if there's no federal budget for 6 months, we don't have the capability to stand in for food stamps in the long term. We just don't have that financial capability. We're mobilizing as quickly as we can. We're doing what we can, but they have to do their jobs.
Is that the end of the thinking and conversation?
Is that what?
Is that the end of the thinking and conversation? Is when you're talking about what to do if this goes on beyond a month, is it just like, well, we don't know because they're not?
No, we are doing things and we've shown that we're doing things. But if your question is, what if this just lingers on and on? Can we make up for what the federal government has done? We can't. They have to do their jobs.
heard. I just wanted to get on the record. The point of these hearings is to get on the record the things that you're thinking, what the plans are, whatever. So I'm asking it so I can hear and get to the public where our thinking is on that. We all know, right, as I've already spoken to, that to be able to meet this moment, we need significantly more than we have in our resources. But in the way of contingency plans or even stopgap something, we wanted to get on the record what it is that the thinking currently was. That's why I'm asking the question.
Right.
I feel a sense like I'm undermining your recognition of the moment. I recognize that. I need to get on record what the thinking is, and that's why I'm asking the question.
Right, and that's kind of what we've gone through in this hearing. What we're doing is what our planning is.
Okay, thank you, Madam Chair.
Thank you. Just to underscore my colleague's point, the big corporate entities in Philadelphia, including one down the road, have given millions of dollars for a new ballroom in Washington, D.C. Just letting you know, they have resources to share and give away, so they need to be at the table being part of the solution. We want to make sure that we don't need to do this ever. We should have our folks in Philadelphia self-sufficient, being able to do one job that pays a living wage, that allows to put food on the table, and we need to not tiptoe around our corporate partners because they are making enormous profits that are not being put back into the city of Philadelphia, and we need to demand that. So I want our administration to Councilmember O'Rourke's point, there are ways to plan further out so that, God forbid, we go beyond too long. We understand that. But I think for us not to know that we have entities right here who can fill these gaps for us, and here we are scrambling around for this $1, and we are making our families really have so much shame associated with having to stand in a food line. So, which is why we want direct payments, which is why we want the corporate sector stand up and do what's right, and we have to demand that. So this is part of what I hope people are listening to, that there is ability to do this. There is ability to meet this moment. We have partners right here who could do that, but we have to ask them because they're not volunteering to give us the money. They're sending it to a ballroom in Washington, D.C., just so you know. I yield the floor to Councilmember Quetzal-Lozada and then to Councilmember Bass.
Thank you, Madam Chair. In an effort to call on everyone that had the potential to be able to help, are we working directly with some of our faith-based partners to be able to become some of those more neighborhood spaces that could help us with identifying food or connecting folks with food as opposed to sending them to the bigger food banks? I know that I have over 500 churches in the 7th Council District. Many of them distribute food. Some come from Share, some come from, Full Abundance. Some come from Small Things and Caring for Friends, but who were not able to take advantage of applying for that grant. But they are the trusted partners. What are we doing to be able to engage them who have direct access to some of these families in need?
I will say that CEO, with their internal outreach teams, are already including a lot of literature as we go around in the neighborhoods and knock on doors in terms of all the SNAP-related resources. But when we discuss individuals or entities like neighborhood community action centers who know who the stakeholders are in those particular communities, including churches, when they do their outreach and go around and spreading the word in terms of training the trainer, we want to give you all the information, all the literature to help spread the word based on your constituents. Those are the things that are going to be occurring to help make that reach farther for us and for you.
So is that already in place, or are we going to put that in place?
That's in place. Okay. That's in place.
And so we are certain that we're reaching some of those immigrant families who are afraid to stand in these lines, but who would go to their local church to be able to receive.
That is all part of the plan.
Benefits. Thank you. Thank you, Madam Chair.
Thank you, Councilmember. We'll go to Councilmember Cindy Bass.
Thank you, Madam Chair. So I just wanted to go back to my colleague, Councilman O'Rourke's question about if this should drag on. and what the administration is prepared to do. And so I know, Mr. Dubois, that you thought that, there were no preparations, okay, maybe I heard it wrong.
I didn't say that, but what I did say is, we can't wholly make up for the federal government, right? That's really literally tens and tens of millions of dollars a month that come to people in food aid. We don't have that kind of resource. That doesn't mean we can't do anything and that we're not planning on what we do, and some of the things that Orlando talked about, some of the things that Dr. Pollack talked about. I just wanted to make the point that we can't fully step up, that there will be challenges that are larger than our resources.
I certainly would understand that this is a totally unexpected expense that the city was not prepared for, but nonetheless, we have to meet the moment. There's no question.
Yep, and that's what we're doing.
Right, but I'm just saying long-term, I'm certainly hopeful again that this doesn't drag on, for very much longer. But if it does, then the city of Philadelphia has to make sure that people can eat. We are ultimately responsible for our citizens. And it's great if we can have help from the Commonwealth. It's great when we get federal assistance. But all of that being off the table, we have to make it happen. We got to figure it out and make it happen. I just really wanted to make that point. And I understand, your concerns and your, worry, but there's always someplace that we could cut, at least temporarily, to figure that out and make it happen. So I just wanted to emphasize that because I'm troubled by the idea that, our only response is, well, they got to do their jobs. I agree, they do have to do their jobs.
And that wasn't the only response.
I know, but I'm sorry, but that's kind of like what, in my mind at least, it was summing up to be, is that, we'll do what we can, but they got to do their jobs. Like we need to have a concrete plan in place to ensure and to reassure people, we got you. No matter what happens, we got you.
Yep, and as we said, this is why we're stepping up now. This is why we're putting in the resources we have, and we will continue to work on it. It was just the point I was making is the scale of food stamps.
I understand the scale of it, but we got to make it happen. So, thank you.
Council member, if I may.
Yes.
Though I can't speak to the infusion of monies from different places, I will say that CEO will always continue to convene working groups to have this conversation ongoing, as it'll never end. So that's something that we will commit to, and we will always take care of. Also expanding our current and internal programs to try to expand our work and reach out for more folks as well.
Thank you, because I think it's just as important, what we do and how we do it. And so if people sort of get the feeling that if this drags on too long, that they're going to be on their own, it's not a good feeling. It's our job as leaders in the city to make sure people understand that we're going to make sure that they eat. We're going to make sure that they eat, and we're going to figure it out no matter what that looks like. So,
Great.
Thank you.
Thank you, Councilmember. Councilmember Rulandau has one quick question. We've spent 2 hours with you, so we have to move along. I know other panelists are sitting. So, Councilmember Rulandau, very brief question.
Very brief question for Rob Dubois. Do you know how much money Philadelphia pays as a whole, income, households, businesses, to the federal government each month in taxes?
Do not know that, but we can try to
Do you
figure
know
that out.
the annual number approximately?
No, don't know that.
We'd love to know that because at some point, Philadelphia can also withhold their tax money that they're paying to the federal government so we can feed our people. It's a plan. Thank you.
Okay. Are you done? Okay. Thank you very much to the panel. I know we have some follow-ups. We will be looking from you, but appreciate all your hard work.
Thank you.
Thank you.
Mr. Sham, if you would call the next panel.
George Matisic, Executive Director of Share Food Program, Lori Jones-Brown, Chief Executive Officer of Philabundance, and Mackenzie Libby, Staff Attorney, Community Legal Services of Philadelphia.
still good morning, 3 minutes left. Please state your name and begin your testimony.
Sure. George Matisic, Executive Director of the Share Food Program. Good morning, Council President Johnson, Chairwoman Ahmad, members of Council. My name is George Matisic, and I'm Executive Director of the Share Food Program, a regional food bank headquartered in North Philadelphia that serves more than 500,000 people per month in the Philadelphia area. I also serve as the co-chair of City Council's Food and Nutrition Security Task Force, along with my co-chair, Mark Edwards of the Food Trust. I want to start by thanking the Council President and this body for creating the Food and Nutrition Task Force. When the Council President first reached out in late 2024, we had no idea how critical this group's convening would be and the need for us to address both the important and the urgent. I thank all of the task force members who were able to join us here today. At Share Food Program, we believe there are two truths behind our work: that food is a human right and that hunger is solvable. These should not be controversial statements, but we have collectively seen the actions of this current White House administration that's made an attempt to disprove them both. Over the last 3 years, the amount of folks coming to us at Share Food Program has risen 120%, all while the federal resources have continued to decline. This year alone, the Trump administration cut more than $8.5 million in food and funds from our organization, representing more than 20% of our resources. And now, in addition to those cuts, the administration continues to target SNAP recipients with only a federal judge's order compelling them to restore partial funding. We shouldn't have to make a federal case out of putting food on the table of our families, but that's literally what this White House is doing. Here in Philadelphia, 475,000 individuals have had food ripped away from their dining room table to be used at a Washington negotiating table. We are pulling resources away from our children to send to adults in Washington who are acting like children. Council President, members of Council, I applaud you for being the adults in the room, for demonstrating the seriousness of governing, for protecting our working class, and for stepping up to find resources for our families. 2 days ago, Lori and I were thrilled to stand with Mayor Parker as historic and timely investment was made into our food banks at a time when it's needed more than ever. This urgent $4 million investment into food banks and food pantries will be essential in increasing the amount of food we can send to hundreds of thousands of families that are relying on us right now. And while it can't fill all of the gaps left by the Trump administration, this is a huge step forward for our city and one I hope we can continue to build upon. In fact, over the last 2 weeks, our pantries are reporting a 12-fold increase in new registrants, a number we have not seen since at least the pandemic. And while there are many echoes of 2020 and 2021, in this moment the difference is, during the pandemic, Washington helped us solve the problem. In this moment, Washington and Washington alone is creating this problem. But while Washington is showing us government at its worst, you, Philadelphia City Council, Mayor Sherrell Parker, continue to show us government at its best. Thank you for putting your words into action today.
Thank you. We appreciate that acknowledgement. We'll take testimony from the next witness, and we'll ask questions all at once.
Good afternoon, City Council. My name is Lori Jones-Brown. I have the privilege and honor of serving as Chief Executive of PhilAbundance, a Feeding America hunger relief organization in the greater Philadelphia area. I want to start by Council President Johnson, in whose district is our headquarters, and Councilmember Ahmad for calling today's hearing to better understand the urgent SNAP crisis. Thank you for taking time to hear how the disruption of SNAP benefits is affecting our most vulnerable neighbors and further straining an already overstretched charitable food network. We are navigating uncharted territory, as SNAP has never before in its 60-plus year history been threatened in this way. Even during other unprecedented crises like the COVID-19 pandemic, SNAP benefits were not only available, but temporarily increased to better meet our neighbors' needs. Now, the nearly 815,000 people in our region who rely on SNAP, including 475,000 right here in Philly, are left without reliable food access, most of whom are children, seniors, people with disabilities, and working families seeking to make ends meet. We know that when SNAP is cut or out of reach, people turn to food banks to fill the gap, and we're already seeing a surge in need, as has been stated today by George and others. Our pantry partners are seeing scared faces and longer lines. On Saturday, the Germantown Avenue Crisis Ministry served a record 102 households, up from their already higher than average 65 households they've been serving lately. Families are showing up at Philabundance's warehouses in Council President's district and Councilwoman Lozada's districts looking for help. And our phones are ringing off the hook from folks trying to navigate the Charitable Food Network, often for the first time. We anticipate this will only increase the longer our neighbors go without their benefits. And this on top of the, let us not forget, 20,000 federal workers in Philadelphia who've been working without pay since mid-October, many of whom are also turning to our food banks and pantries as their only valuable resource to put food on the table. Philabundance and our partners are committed to doing everything we can do to fill the gap, but here's the reality. You'll hear us say this over and over again. SNAP is our nation's #1 defense against food. To put this into perspective, for every one meal we provide, and we provide millions of meals each year, 36 million last year, for every meal a food bank like ours provides, SNAP provides 9. Despite our best efforts, food banks cannot possibly make up for this loss, a loss of this magnitude. There's simply no substitute for SNAP. Nonetheless, Philabundance and our incredible partners are stepping up to meet this moment and help bridge the gap. Philabundance a couple weeks ago committed to providing at least 25% more food to our network over the coming months. That's an increase of 600,000 meals each month at a cost of nearly $1 million. A couple weeks ago, we ordered 5 truckloads and got that in and started posting that already for our partners to take advantage of. Even with that, they're saying they need more. We also coordinated the larger Charitable Food Network with our direct partners and others 2 Fridays ago, asking what resources they had to share and what resources they needed. And of course, thanks in large part to the support of the City of Philadelphia announced earlier this week, the Commonwealth of Pennsylvania's support announced on Friday, and other donors were able to increase that even more. So we're grateful that through this emergency funding coordination partnership, we'll be able to help supply our 210 Philly-based partners, about 40% of whom are faith-based institutions, with more food and provide our neighbors with more hope. We were relieved to learn earlier this week about the SNAP benefits. I won't go into that part of my testimony. I think the city solicitor explained that. The upshot is that even as we're hearing some positive progress, we really don't know how much support is going to come to neighbors, and frankly, when they're going to get it, and then how long that support will last. So additionally, I want to be clear, our neighbors are facing a hunger crisis. We're facing a hunger crisis even before this lapse, and they will continue to face a hunger crisis after the government shutdown ends, and when, and hopefully soon, SNAP benefits are once again received in full and on time. Food insecurity had already been on the rise, affecting 1 in 6 Philadelphians, including 1 in 3 children, as the council president has noted, and has been highlighted through his task force work. Our pantry partners had already been reporting a 30% and higher increase in need over the prior year, with a particular surge, interestingly, in dual-income households seeking support like never before. Across this region and country, we saw a 44% increase in the number of people who are food insecure from 2021 to 2023. 500,000 people in our region, which includes South Jersey, in 2021, up to nearly 700,000 in 2023. This was before this current SNAP crisis. Meanwhile, our network has been left with less resources to meet the growing need, as key federal programs, and George mentioned some of them, that directly support food banks were eliminated earlier this year. As a result, empty shelves have become commonplace. I invite you to visit our warehouses. In 5 years, I've not seen them as empty as they are now. Some pantries had to reduce how much they could offer each guest. Small Things in Fairhill was offering guests 30 pounds of food each visit at their free grocery store. That's been reduced by half down to 15. On top of this, our network has been operating for 5 months now, let us not forget, with no state funding because of the Commonwealth of Pennsylvania state budget impasse. We are feeling that in the nonprofit sector. And of course, and I appreciate that you mentioned this to CEO, and thank you, Orlando, for your testimony earlier, that we also experienced the harmful changes included in the legislation signed into law on July 4th, and we're trying to navigate that as well. And let me also remind you that people needing support navigating SNAP benefits even before this current crisis, remember that in our city and region, our two key resources for that, for people, went away last year. A year and a half ago, we lost 2 critical nonprofits that were helping people navigate the benefit system. They're no longer here. We've, in this moment at Philabundance with others, with our incredible partners at PASI, also been looking to ramp up to provide people with supports around SNAP. And I also want to highlight, I know you'll hear from Mark later, that also at this moment, SNAP Ed resources were taken, the federal government ended those too. So in the face of these challenges, we at Philabundance, with our incredible partners, will continue to do everything we can to ensure our neighbors have access to the food they need. But we cannot do it alone. And we know that through conversations like this, that we have City Council, the Mayor's office, the Mayor and the administration standing with us. We do believe that together we can work to relieve hunger now and end hunger for good. Thank you. I will also just note that my colleague, Callie Perrone, is here, our government relations manager. I will be leaving momentarily, but she'll be able to answer any questions, and I'd be happy to follow up and answer any questions as well. Thank you.
Thank you. Please proceed with your testimony and state your name.
Good afternoon, Mackenzie Libby, staff attorney at Community Legal Services. Thank you, Council President Johnson, Chairwoman Ahmad, and the Committee on Public Health and Human Services for organizing today's hearing and for standing with Philadelphians during this extraordinary crisis. As many others have mentioned, as our city unites to support families facing hunger this month, we cannot lose sight of the harsh new rules that also threaten to take food away from the over 470,000 Philadelphians who rely on SNAP every month. But before I talk about those new barriers to SNAP, I want to speak briefly about the barriers that existed long before these changes. CLS has represented families who need SNAP benefits for decades. In the last year alone, CLS represented 345 Philadelphians who were unfairly denied SNAP. Our clients are seniors struggling to get by on fixed incomes, working parents with young children, and disabled people who are surviving on no income while they wait to be approved for disability. The most common reason that CLS clients lose access to SNAP benefits is paperwork. Renewal packets that go missing in the mail, delays scanning timely submitted change reports, or pictures of pay stubs with the date accidentally cut off, just to name a few examples. SNAP work requirements create even more paperwork and red tape that will take food away from Philadelphians. New rules, as many have mentioned, set a time limit for adults between 18 and 64 who do not live in a SNAP household with a child under 14 and who do not receive disability benefits. If people subject to these work requirements cannot prove they are complying or exempt, they may only receive 3 months of SNAP every 3 years. Pennsylvania estimates that 30,000 Philadelphians became subject to these new work requirements in September. SNAP recipients who are already working an average of 20 hours per week, as the rule requires, should be sure that the County Assistance Office knows about their work, but compliance is not always simple. Home health aides, crossing guards, and other workers whose hours fluctuate must report every time their hours drop below 20 hours per week. If they remain out of compliance for 3 months, they will stop receiving SNAP and will not be eligible for benefits again until January 2027. When work requirements were in effect in other parts of the state in 2016, nearly 2/3 of the people subject to those work requirements lost their SNAP after 3 months. The best way, as has been mentioned, to help Philadelphians keep their SNAP is to help eligible people claim exemptions from these paperwork requirements. Many adults meet at least one exemption, which will allow them to keep their SNAP until their next annual renewal. Importantly, workers who earn at least $217.50 per week before taxes are exempt as long as the County Assistance Office knows about their work. Adults are also exempt if they have a medical condition that reduces their ability to work, are pregnant, caring for a sick family member, participating in a drug or alcohol treatment program, receiving unemployment compensation, or experiencing homelessness. A complete list of exemptions and guidance on helping SNAP recipients claim exemptions, as well as the necessary forms, can be found on our website at clsphila.org/snapchanges. In addition to work requirements, Pennsylvania DHS began implementing SNAP immigrant eligibility restrictions required by H.R. 1 on November 1st. These new rules end SNAP eligibility for humanitarian immigrants who do not have green cards. These restrictions apply to anyone applying for benefits after November 1st and current recipients at their next annual renewal. The best way to keep immigrant families connected to SNAP is to ensure that any household member who has a green card has shared a copy of that green card with the County Assistance Office. The delay of November benefits and the impact that has already been felt throughout our communities highlight the fundamental importance of SNAP for our neighbors, our economy, and the health of our city. I thank City Council for your commitment to ensuring continued access to this vital program. We look forward to working with all of you to help prevent hunger, and CLS will, of course, be there to assist anyone who loses their SNAP as a result of these changes. Thank you.
Thank you very much. Start with you. Question about the immigration, who's eligible, people with green cards, people in asylum hearings or things of that nature who don't have ability to work, means they can't pay for stuff, they're not eligible.
So someone who is, let's say, an asylee or refugee who has not become a permanent resident, has not gotten their green card, may be able to work, may have work authorization, but those people are not going to be eligible for SNAP at their next renewal.
So we just want to make sure, we should probably talk offline to have clarity as to what these categories are and who's eligible and who's not, and align that with the work requirements, because if you're not able to work, you're not able to have money. So we're going to have hungry people sitting on the street, basically, is what you're saying. The second thing I wanted to just state and ask for your feedback, what I'm hearing is, outside of this emergency, we still have created such a onerous system. We're going to exclude a lot of people, right? With this, all these ways of reporting, and the surveillance of people is going to be so much heightened. It seems to me that we need to have these alternate pathways to buttress what SNAP is going to do beyond this crisis, right, going forward, till we have a change of administration, or we are able to change the laws or have more accountability through the court system. So in that gap, what we have discussed about our corporate partners, our philanthropic partners, the state who has a big surplus sitting there, all of these folks need to be mobilized as an additional, even when SNAP is restored, right? So I want all of you to stay alert about that, and advocate, because without that advocacy, we can say some things, but the pressure when the constituents of everybody who's elected in state happens, that's a much bigger pressure. So please make note of that. Lastly, I wanted to just understand the money that was allocated to both SHARE and Philabundance. Do you have a sense of the percentage that will go to overhead and what will go to actual, service providing the actual resources?
0%. 0% will go to overhead.
So, say that again?
100% of it will go to food, 0% will go to overhead.
0%, all right.
Yeah, same.
Same. So you're just absorbing, you're just keeping your admin going the way it was and absorbing extra work to do all this?
Yeah, I mean, obviously, the costs for both organizations are continuing to climb, but
Yeah.
right now, we need food out to our communities, and that's what we're all prioritizing. So for us, we're buying pre-made, at least a portion of it will be for pre-made boxes of food. That's one of the big requests we're getting for right now, as those lines continue to grow. So that's, yeah, we're every dollar that we're raising is going for food, and then to some of our partner organizations as well.
All right, thank you, Council President.
Yeah, and I'm going to decline to my members, but just a couple things. Well, one, thank you, George, for your work in this area and being co-chair of the task force and convening the work that you already have been doing. Even prior to you being a part of the task force, we've done stuff in Grays Ferry and being on the ground in South Philadelphia. And obviously, Lori, thank you as well for your hard work and your dedication. Also in this space, right, and the work that you've been doing and kind of navigating and showing me the process early on in terms of, you know, how this process works in the space of food. I called it insecurity, and then I was told from the task force it's not insecurity. We should be saying food security, right? Just give us an idea of how far can you stretch $1 million? Because even before the city got involved, y'all were always advocating and trying to find partnerships because, again, this is only one moment in time. We've been dealing with food insecurity prior to this, which made your lives much more, I guess, interesting in terms of advocating and trying to find ways to make sure we're feeding those who are most vulnerable. So in the grand scheme of things, like how far does $1 million really stretch in terms of the work that you are doing?
So, you know, I've been asked, I've been asked a lot about like how we're feeling, and I try not to, being a person of faith, talk about being worried. This is a moment where I'm worried, I probably should say concerned. The reality is, before this challenge, there is no way we can ensure that everybody had a meal. There's no way we could. And then you've heard us say over and over again, for every meal, this what SNAP could provide. So I personally feel really inadequate at this moment because I know we can't make up that gap. But to tell you the numbers, what we had committed to do already was to go from distributing 2.4 million meals in the month of November, increase that to 3 million meals. That is for both southeastern Pennsylvania and southern New Jersey. So that 25% increase, that's what comes up. 600,000 meals, additional meals each month. It costs us, for every dollar we can buy 2 meals. And so essentially one way of looking at the $1 million is it's 2 million meals. And that, the way the contract works with the city, that is specifically for Philadelphia. So we're doing others outside of that. So that'll be 2 million more meals that we'll be able to provide within the city of Philadelphia over this time, which sounds like a lot, but I will admit, because we're all friends here, that we're talking about, if it was 2 million meals, that's what, 4 meals for each of the 500,000 people that are on SNAP, right? Like, just like, you take about the scope of it. So I am grateful to be a part of a network that has rallied the way that it has, grateful to have support that we've seen at the city, the state level, individual donors, individuals, you know, showing up. But I have to admit, Council President, I still feel concerned and inadequate, even though I'm proud of what we'll be able to do and what our team is already doing.
I mean, Budget Director DeBoe said it himself, right? That this is not nearly what is needed to make up for the impact that the SNAP program has. Nor can food banks ever make up for what the SNAP program is. That is the primary defense. And frankly, I should say, the fact that a share food program exists at all is a policy failure. We shouldn't have to be doing this work in the richest country in the history of the world. We have the resources in this country, we have the resources in Washington to be able to address food insecurity. We say, on every t-shirt that Share Food Program has, we say food is a human right and hunger is solvable. It is what makes the work that we do so infuriating at times, is that you guys deal with very complex issues, right? Things like crime, things like addiction. These are really complex problems that don't have a single solution. For the work that we do, it's actually really easy. We just need to get the food to the people who need it. And I do want to applaud my city for taking a step forward. Is it everything that we need? Absolutely not. Everybody in this room, I think, agrees to that. But it is at a time when we are seeing great uncertainty in Washington. I feel certain what the folks in this building are doing to help support our communities.
Covering for Chairman Ahmad, I recognize Councilmember O'Rourke and then Councilmember Thomas.
Thank you, Madam Vice Chair. Thank you all again for being here today. Thank you for your testimony and for the work that you do every day. I've had the privilege of, like every other member I'm sure, to tour in Philabundance and other places as well, and working with you as well recently. Thank you for what you do to support Philadelphians who are in need. You talked about the increased barriers that many folks face even to access SNAP, as well as how food banks are being squeezed from all sides and from the inside, including due to the state's budget impasse, which just to make this point, I feel very strongly by the day, whether it has to do with food, whether it has to do with housing, whether it has to do with transit, municipalities are increasingly going to have to learn to stand on our own 2 feet. We cannot rely on the federal government or the state anymore. That should be a realization that's processed and digested, and then therefore fundamentally change our approach so that we don't come before panels and ask about what the contingency plan is and say they have to do their job. They're not. And so something like an answer, would have to suffice. I appreciated Mr. Wren that he just stepped out for actually staying behind a little bit longer to hear what you all would say and what maybe the public commenters may say or whatever about what we might need to do. So my question is, if it were up to you, what would the city do to fill these gaps? And I recognize nothing that we do even prior to, but
I have a little bit of a background in city government, and I have to say, a little bit of a background in city government, and have the honor also of working with CEO as a volunteer board member with them right now. I was impressed Monday evening when I heard from all of the departments in the government, as well as utilities, standing up and saying, here's how we're helping people in this moment. They responded to SNAP recipients, they responded to federal workers, and they even talked about programs that other residents could have access to. I've not in a while seen that level of coordination and thoughtfulness. And again, I've been doing this work for a while in a variety of ways. So I have to say I was impressed and did not expect to be. I thought, okay, you're going to announce what you're doing, great. I was impressed by the way they said. I mean, what they said, you heard from DHS across the board, the utility side, rental forgiveness, revenue support and forgiveness, a coordinated way. They also thought about the commerce side of it. There's a grocery store near me that received 80% of its receipts are SNAP. So they're thinking, okay, how do we make sure we keep them going in this moment? Because we know we already have food apartheid across the city. How do we make sure that doesn't get worse? So in the moment, I would say first, it's impressive that the city is thinking about this in such a comprehensive, holistic way. And I think that in this moment of crisis, how do we take that and build on it? Because we know this is gonna last. And then the other piece is that we're thinking about what happened was signed into law on July 4th. This next piece we're going to be facing is Medicaid, right? And so I think there's a real opportunity. And so the only thing I would add to that is what work we're doing. I think we can continue to ensure that there is coordination among all of these networks, right? And so we serve at Philabundance, we have 210 that we work directly with. We know there are hundreds of others of organizations. I think we can continue to make sure that there is more conversation and coordination. I think one of the things we need to be doing in this moment is ensure that we are maximizing the impact, getting as much food to people as we can, and reducing redundancy. So I think there's a little bit of opportunity for us to do more than that. But I have to say, I was very impressed with what Mayor Sherrell Parker and the team put together. And really, again, I have to say, too, what was already happening with Council President Kenyatta Johnson's task force.
So the answer to what we need long-term, my hope is will be addressed by the task force, by the Food and Nutrition Task Force over the course of the next few months, with the hope by early next year we would be able to release a list of what we as a larger food access community are going to be looking at. Because the reality is we are, as a city, it's like we have 475,000 people right now in an urgent situation. It's like we're in the ambulance right now on the way to the hospital. But what does the long-term care look like for those 475,000 people who rely on the SNAP program every day? And so yes, Lori and I could tell you what we could do today to help relieve poverty and food insecurity, more importantly, for today. But that doesn't address the long-term systemic challenges that we need to, and that's something that I hope, along with our food task force members, we can address over the course of the next few months.
I would just say that I actually think that that's a great, what you have said and what Ms. Lori just said as well is good. I want to acknowledge that Commissioner Ali stayed as well, so thank you for being here to hear those sorts of things. But, asking the question, how do we build on the heretofore maybe not seen or rarely seen cross-collaboration that has happened since Monday to figure out how to do this, sustaining that for the long term, that's even an answer. And I appreciate saying that we recognize that there are ways for us to meet the moment, to ask questions about deep insecurity and struggling in a moment and figuring out what we can as city government do about that. And I think doing that sustaining that beyond this moment, I think is important in light of the fact that it becomes evident by the day that the state and the federal government is incapable of meeting the moment. We got to stand on our own 2 feet. So thank you for answering that. One other question, and then I'll hang up. While food banks are incredibly important, we've heard from constituents that sometimes they can be difficult to access, given they're open certain hours, delivery options are often saturated, there are language issues. Can you speak to the potential pros and cons of more direct forms of assistance like SNAP beyond the mere scale of the program? For example, in terms of access, people's agency and choice in food, ease of use.
So,
cultural relevancy. Yeah.
Sorry, was that?
Cultural relevancy.
Okay. So, again, SNAP is the most important program that we have to relieve food insecurity in our region, right, and in our country. We would love nothing more than to have the resources and the ability to be able to provide access to food 24/7. And I would say, as a network here in Philadelphia, we find all types of innovative ways to be able to do that. And yet, again, in the richest country in the history of the world, we don't have all of the resources that are required to be able to do that. But make no mistake, our collective goal is if somebody of means can go online and order food and expect it to be on their doorstep in 2 hours, the expectation should be that somebody that doesn't have the means should be able to do the same thing. Our goal within our food insecurity network needs to be to have the same level of service, dignity, quality between the haves and the have-nots. And I think that's the long-term work that we need to address within our the Food Security Task Force to be able to make sure that not only are the ones who are doing relief for today able to raise our level of service, but also that we are creating the network long-term to address these systemic issues that led us here in the first place.
And I put a pin on that. Yeah, and I'm glad you said that. And I do have a working group that deals specifically with job training, growth, and development, right? Because also we want to put more people to work. We want to build generational wealth, and hopefully an individual won't have to go and apply for SNAP, right? We'll actually put you out of business. That's the long-term goal, but I'm glad you talked about the systemic issues that arise as to how we got to this particular point in time right now. But the key moment is rising to the level and addressing the issue. I do know, and I know Rob DeBoe left already, and administration left already, but I know they're always watching, and so we do have a reserve, Federal Reserve, that we put to the side early on, or the administration put to the side early on. At one point, it was 93 million, additional 5 million, so I'm gonna round it off because I learned that in public school. About 100 million in Federal Reserves, because the question was asked, in the event that things don't go right coming out of Washington, D.C., that we will put some funding to the side for rainy days, so to speak. Well, it's raining, and so obviously as we move forward, we'll have a longer discussion with the administration on how we continue to have a robust approach in addressing this very critical issue. Thank you, Madam Chair.
Thank you, Council President. It's a monsoon. I wanted to yield the floor to Council Member.
And for the record, we're ending FY25 fund balance 1.2 billion, the highest it's ever have been. And so we will be paying attention in terms of how we advocate, as my good brother O'Rourke says, for the least of these as we go through our budgetary process.
Yes, well, thank you for that, and for saying that we need you to be obsolete.
Yeah.
We want people to have agency and a job that pays a living wage. We have $7.25 is our minimum wage. Unbelievable, inhumane is the word. So, so much more to talk about the long-term solutions we need to look for, but I yield the floor to Councilmember Isaiah Thomas.
Good morning, good afternoon, I'm sorry, Madam Chair. Thank you for your leadership on this. Of course, Council President, thank you for your leadership as well. Members of the committee, thank you for your amazing questions. I have no questions. I just want to say thank you for the great work that you do. I've been listening to everything so far this hearing, and the information that you provided is amazing, but the work that you do is greatly appreciated. I know my office partners with the organizations that are here right now to do this work, and we have been doing it for some time, but like Council President said, the goal is to put you guys out of business. And similar to what Councilmember O'Rourke said, we can't just rely on other levels of representation. As a city, as a municipality, we have to think about a lot of different complex issues in ways that we didn't have to think in the past. So it's unfortunate that we're in this position, but I do thank God that the people who have the seats that they have currently right now have the hearts and they're humanitarians, and they care a lot about the people in the city, especially our children, and I'm excited for the next panel to be able to listen to what the school district and other folks who focus on young people have to do. So, Madam Chair, I just wanted to take 65 seconds to say thank you for the great work that they're doing. It's very much appreciated.
Thank you, Councilman.
Appreciate that, Council Member. We're going to go to Council Member Quetzalcoatl.
Thank you, Madam Chair. Looking at this from all angles, we are going to see an increase, as we've been talking about, of people getting in lines and coming to get food. Is there I've been at some of the Food Abundance distributions, right? I've given out food in my district office as well. Is there a plan or a way to be able to help those who are coming to get in line to be able to pick up this food? You know, I'm sure you all heard us last week, we voted on a bill that would require people to pay for paper bags or for plastic bags. That's an additional burden on people. You know, we're asking people to figure out how they're going to collect large amounts of food from different spaces. Do you see this as being an additional burden or a challenge for our food banks, for our pantries, for our residents? Is Food Abundance and your partner food banks prepared to be able to provide residents with these additional bags that are going to be required when they're coming to pick up food?
So for Share, I can tell you one of the things that we're looking at is additional boxes of food. So if you remember during the pandemic, we were doing a lot of boxes versus having the lines. And It's really for a couple of reasons, but one of them is just to, for line management. The lines that we are seeing are increasing at really unprecedented rates, and so there is a need because of that to try to get people through quickly. And so we'll likely be doing more packaged boxes over the course of the next week or two. Long term, obviously, our goal is to provide the most choice as possible within our network, whether it is at our pantries. And I think that's also one of the biggest evolutions that we have seen over the course of the last 10 years or so within the food banks, is that there's a greater priority on providing more choice and working with more of the partner organizations who have the additional capacity, not just to be able to have, to be able to manage the lines and have more ability for choice, but also really working on what I think is the goal of everybody here: how do we end up shortening that line in the long run? And that is, how do we use food as the gateway to the other programs and services to help pull people out of poverty? And so those are all the resources that we're trying to pull together. And when we look at our pantry network, we're evaluating a number of different things for us at Share Food Program. It is not just where you're geographically located at or how much food can you store there, but what are the other services that your organization is helping to provide that is going to help somebody get the additional assistance that they need to pull themselves out of poverty.
Yeah, and I agree with everything that George said. Philabundance is trying to do very similar things. These past few years, we've been very much trying to support our pantry partners in increasingly adopting choice models, in additionally adopting a more than food approach where they can get holistic wraparound services while they're attending or while they are visiting a food pantry. Yet in this moment, there is a lot that we're balancing. So yes, to the degree that we can, we're focusing on the food that we can get in the quickest and get out to our neighbors the fastest as well. And yes, a lot of that will come with, prepackaged boxes and bags, and focusing on really serving as many people as we can in this moment. So it is a balancing act, and it's not ideal. And yeah, agreed. There is really no world where food banks should be existing in the first place in this country, but here we are. So.
For some of the seniors, for instance, when I distributed food at Esperanza, for some of our seniors, many of them preferred to take the food out of boxes because it was just easier for them to carry. And so, are we working with our partners to ensure that the no box option is available? And if so, are we working with them to prepare for additional bags that they're going to be able to use if they don't bring enough?
Yes. Well, one of the other things that we've done over the course of the last few years, particularly for seniors, is incorporated a home delivery option for seniors that get the food delivered directly to their doorstep, so they don't even have to worry about taking it back from the pantry. So at Share, we now serve north of about 5,000 seniors per month that get a home delivery. We have a partnership with DoorDash. As of now, our partnership with DoorDash is the largest single DoorDash distribution of any type within the country. So it's something that we want to continue to prioritize. It also gets back to what I mentioned earlier about equity in food distribution, right? If somebody of means can order in 2 hours, somebody who doesn't have the means should be able to do the same thing. We want to deliver that level of service. But absolutely, we want to make it as easy on everybody, as dignified as possible for everybody to get the food assistance that they need.
Thank you. Thank you, Madam Chair.
Thank you. If there are no other questions for this panel, we thank you and
Thank you
ask
so much.
the clerk to invite the next panel.
Thank you.
Teresa Fleming, Chief of Operations, School District of Philadelphia. Lisa Norton, Executive Director, Food Services, School District of Philadelphia. Elizabeth Keegan, Food Services Coordinator, Dietetic Services, School District of Philadelphia, and Lauren Nocido, Director, Nutrition Education, School District of Philadelphia.
Thank you.
Good morning, Council President, Councilmember Ahmad, and members of City Council. My name is Teresa Fleming. I serve as the Chief Operating Officer for the School District of Philadelphia. I want to thank you for the opportunity to speak with you today about the district's efforts to ensure students continue to access nutritious meals. At the School District of Philadelphia, we are steadfastly committed to the well-being of our students, staff, and families. We understand that the ongoing government shutdown and the resulting SNAP benefit reduction raises a lot of anxiety and poses a significant challenge for many Philadelphia families. We take that very seriously. We're going to hear from Lisa Norton, who is our Executive Director of Food Services, that's going to provide more details on ways that the district is supporting families.
Good morning, and thank you. There are a number of ways that the district is supporting families. Most immediately, we want to assure you that the district's school meal program remains operational and will continue to serve every student. Our mission is to ensure that no child goes hungry during the school day, and we're committed to providing nutritious meals that fuel learning and academic success. And here is what you need to know. An overview of our district program. The Office of Food Services offers full service and pre-plate meals across 253 public and 3 charter schools. Our average daily meal participation is 102,300 meals over breakfast, lunch, and after school. 100% of district-enrolled students are eligible to receive meals at no cost, breakfast, lunch, and after school at no cost under the federal community eligibility provision. The SNAP reductions do not have a direct impact on school meals. The district, however, anticipates higher participation rates across all meal programs as students of families facing food insecurities may look to school meal programs as a source of daily nutrition. To meet the needs of the increased participation, we've developed a proactive strategy focused on closer collaboration with school leadership. This will help us quickly identify students who may be at risk of going without food. Our goal is to ensure no student goes without a nutritious meal during the school day. In preparation for the increased demand, the district is engaging proactively, communicating with school leaders, community school coordinators, and our current vendors to anticipate the increased volume. This also involves reviewing our current inventory, staffing levels, and delivery schedules to ensure we can scale up meal production without compromising quality or service. Our overarching goal is to ensure no student goes without a nutritious meal during the school day. Students may struggle to learn if they are hungry, and it's our collective responsibility to remove that barrier. Now you will hear from Liz Keegan, a registered dietitian and a food services dietetic coordinator.
Thank you, Lisa, and good afternoon, all. We recognize at the school district that these reductions, the SNAP reductions, may create gaps in access to resources. To help us address this, we ask for your support in communicating the meal programs available to your constituents. Nutritious meals are offered at all schools during the school day and after hours through our after-school meal programs. In addition, our extended day and extended school year locations provide an added opportunity for students to receive a well-balanced meal beyond regular school hours. We are, in Philadelphia, one of the largest urban districts in the country. Despite having such a large student population, participation in school meal programs remains well below what our capacity is, meaning thousands of students who are eligible for those meals are not taking advantage of what they have available to them or may not even know what they have available to them. By increasing awareness and reinforcing that these meals are available to all students at no cost, we can work together to close this gap. Now we will hear from Lauren Nacito, our Director of Nutrition Education.
Hi, good afternoon. I'm going to talk a little bit about nutrition education and our SNAP-Ed partnerships within the School District of Philadelphia. So SNAP education, or SNAP-Ed, has been eliminated at the federal level. Therefore, the district team members and 6 external partner organizations may be sunsetting at the end of the 2025-26 school year. Implementation of SNAP Ed in the School District of Philadelphia is known as Eat Right Philly to our students and our schools. It is one of the most robust school-based programs that supports student engagement and has been consistently supporting student wellness for over 20 years. Last school year, Eat Right Philly across the district reached 213 schools with various initiatives, and over 36,000 students participated in hands-on nutrition lessons with Eat Right Philly team members. Eat Right Philly offers engaging lessons and activities which often include getting a chance to chop vegetables for a fun family meal they can share at home, or getting their hands dirty in a small garden to understand where food comes from. These activities almost always include a food sample to provide exposure to new foods that might not be tried at home. The goal of SNAP education is to encourage families to choose the most nutritious items when they shop at local stores or take advantage of the many produce stands around the city. Additionally, Eat Right Philly has been the impetus for the Groceries for Good program that provides 18 to 20 schools with monthly free produce distributions after school hours for families. Bringing fresh produce to schools conveniently for families has helped school staff address food insecurity for their families. Over the last 4 years, this program has distributed over 400,000 pounds of fresh produce to families. In closing, we hope this information and resources are helpful during this challenging time. The health and well-being of students and their families is our top priority, and we are doing what we can to provide every student access to healthy meals that they need to support their success in schools. Thank you, and we welcome your questions.
Thank you so much. It is good to know that the school district has such a robust plan, but concerning that children are not availing this. And so I just wanted to understand how that works. Like, children come to school and they have availability for lunch and breakfast, and they're just not coming to this? Or what does it mean when you said that there's a low participation?
The meals are accessible for the students, and they're just not participating in the meal program. So during lunch period, all of the students that are rostered in that particular period may not be coming up to the service line to get lunch.
Do we know what they're doing instead?
In terms of meals, no.
So should not we know? I mean, they're in your purview, they're in your cafeteria, so we should know if they're not taking meals, are they bringing lunch, are they buying lunch? It would be good to have that data to know why we have the capacity to have nutritious meals, or maybe the meals don't taste good and they don't want the meal. So I don't know what the data says, but we need to have follow-up on that if we are saying people are not using the services.
I would just like to add that's a part of our plan where we plan to collaborate more with the school leaders and our community stakeholders to understand what those gaps are and how we can encourage more students to take advantage of the meals that's accessible to them.
So I just, not to belabor this point, this is not something new, is what I'm understanding.
Correct.
And we're just having a plan to do this worries me, why we have not had a plan. From the day we had ability to give resources to our children, we should be collecting data. How many people using it, who's not using it, which school is not using it. This should be at our fingertips, right, to know where we need to, and then are we actually informing our families? Are we putting a letter in their backpack to say, do you know that we have these things available? Please tell your child, use it. Do we have all of this in place? Because
absolutely, Councilwoman.
We do, and they still are not using it.
Correct.
So have we found out why? Have we surveyed our children? And the answer is?
There's more than one answer to that question, and unfortunately, the metrics for it are very hard to gauge just because there's such a wide range of reasons why students don't want to participate. It could be because of stigma, it could be because of various reasons, timing-wise, and So we continue to look down this pathway to see how we can reach these students, going out to the main locations where we do see lower participation. We survey those students, and some of these questions some of these very questions are questions we pose to the students, and most of the time is they say they're not hungry. We know that's not the case. We are continuing to try to find ways to make sure that what we're giving to our students is what they want to eat. In the next couple of weeks, we'll be having a student food show where we have over 900 students coming down to our central office and sampling different food items to make sure what we're preparing and what we're serving on the menu is something that the kids want to eat. Because we understand that if we have these meals available, if the kids are not eating them, they do nothing for their nutrition.
So I wanted to understand the budget that is allocated to provide these meals that are not being used. What are we doing with those meals? How much money are we spending? And if it's not yielding results, we can't do the same thing and expect different results. I just wanted to hear, what is the budgeted amount for that?
The budgeted amount for the
School
for
meals.
The Office of Food Services, we have a $100 million budget.
And if we were to look at the number, how much of that 100 million is actually meals, and how much of those meals are going to waste?
And so when we talk about waste, it's hard for us to quantify. I know that we talked about food going in the trash, and so the way that our program works, when a student comes up to the line to get their meals, there are a certain amount of components that they have to take for it to be considered a reimbursable meal. And there are items that if the student doesn't want, they put it on a share table. So therefore, another student that may want another apple or fruit cup or milk has a share table to go to, and they can have additional food. That's how we work on the waste.
So there's no throwaway of food from what I heard earlier. No food is thrown away?
In food services, we don't throw away food. So
Where does all the food that went to the share table, didn't get used, what happens to that?
Well, then there are some organizations that in some schools that come and collect the food. We do have some food pantries in schools. For Central High, they have a food pantry. They come and get the food and put it in a refrigerator so students throughout the day can come and access that food. Once the food crosses the line, once I reclaim the food, food services cannot handle it again, if that makes sense, because
Yeah, however, I hear you. It's just a waste of money and food, right? So we need to find a way around this where every school should have an ability to save this, so our families allowed to come to those pantries and help themselves?
if the school has a food pantry.
So should we not have a food pantry in every school? If Central has one, and Central probably needs it less than many other schools, we should have it in every school. And so that should be a policy, that we have leftover food on the day. Right now, we should institute this immediately because we could alleviate hunger right today if there was a food pantry. It doesn't take a lot to set up a food pantry. I know there's a whole bureaucracy. We cannot allow bureaucracy to make us go hungry, just putting it out there. So you guys have to pivot, do whatever you have to do to make sure all the food that is not being used is put out for families to come and take it. Just take it. Right? So there's no accounting here. It's already accounted for because you put it out there. So I behoove I hope Dr. Watlington is listening. I don't know who needs to make the change, but we are on the Education Committee for Council, and we are going to be asking why this is not immediately instituted when we're having a hunger crisis in our city, which we cannot have one iota of food go to waste. So let me be absolutely clear, we'll be following up on this ASAP to see how quickly we must pivot to meet the need. Thank you. Councilmember, I'm just incensed. Councilmember Skitsi-Lozada. Oh, okay. Sorry, can we just do our chair of the Education Committee? Sorry.
I'm gonna be brief. Good afternoon. First and foremost, I just want to say thank you to Teresa Fleming, our Chief Operations Officer, as well as Chris Johnson, Public Relations Person, for the work you guys do with us when it comes to these issues. Because when we're talking about hunger and dealing with government, I mean, it's going to be you guys that the chairwoman is talking about that we're going to have to follow up with. So we appreciate the fact that you always gets back to us, but this is a serious issue. One of the things that I've been really concerned with since I became the chair of the Education Committee is the procurement office. And the School District of Philadelphia has done a really good job of increasing the percentage of contracts that go to Philadelphia-based businesses. When I became the chairman, that number was below 5%. Now that number is well above 20%. So we're thriving in the right direction. But one of the contracts that I've always been critical of is the RFP contract for food. I've been very critical of it because that contract puts us in a position where a lot of the things that Dr. Ahmad is asking for right now, it's okay for us to say yes and we're going to follow up. But I know firsthand, based on our quarterly fiscal meetings, there's not much wiggle room that you have right now as it relates to the current contract. And then I believe it's a New York company that provides food services for us in the city of Philadelphia. So I'm telling you, if you don't know, that contract is going to be coming up soon. And I just wanted to add to what Dr. Ahmad said. We're going to monitor what happens with that contract, not because we want to impact what company you choose. We want to impact what region it goes to, i.e. Philadelphia. And we also want to make sure that it gives autonomy to building leaders to have a little flexibility to do some of the things that Dr. Ahmad is saying right now, because I know firsthand, based on that contract and based on the requirements, you can't do those things. Now, as it relates to the young people eating the food, I'm sitting here talking to Council President, and I'm sure he's going to add his couple cents to his lived experience. But you know, I'm a product of the School District of Philadelphia, Elwood, Conwell, Frankfurt. I also still coach high school basketball, as a lot of you know. I'm very much involved with young people, and I'm in the schools on a consistent basis. And I can tell you that stigma is definitely a part of the reason why young people don't eat free food. That's for sure, but it's nasty. That's a part of the reason as well, too. And so, you know, I know that the great folks at Unite here who serve the food, they're not going to be offended by this because they don't have much say-so and much wiggle room as well either. So no particular question. I just wanted to add to the concerns from Dr. Ahmad because I think Dr. Ahmad's line of questioning was right on point. But there are some things that we can do when that contract comes up. But we should do some things in the immediate right now. And one thing I would suggest, based on what Dr. Ahmad said, just a simple survey. Let's just survey everybody. So when you come back before us, when we have our annual meeting in a couple weeks, we can be able to say, maybe we distribute the survey, maybe we have the results of the survey back. But I think data is important for us, and I think it's important while we're dealing with this crisis that people understand exactly how the young people feel. We can all offer our theory and lived experiences from when we were younger, but let's hear from them. Let's let them tell us exactly what their perspective is as it relates to what we used to call freebies. I don't know what y'all call them, press. But let's hear their opinion as it relates to the free lunch and let them have some say-so as it relates to their perspective on what we're doing. Madam Chair, thank you so much. I just wanted to offer perspective to the line of questioning that you had.
Thank you. Council President, you wanted to?
And I'll be real brief. And just in terms of this space, is there anywhere in America where the children go to public school and I'm gonna say, put it this way, do we have chefs that actually just cook for the kids when they come to school? Is there any model like that? Like fresh food cooked for students when they come as opposed to mass packaged meals? Is there any model like that?
Absolutely.
In the country?
We have pre-plate, which is what Councilman Thomas was talking about, the contract. And then we have full service locations where we prepare the food on premise. And we have 140 full service locations and 113 of the pre-plate that Councilman Thomas was talking about.
So you come in, you look at the menu, early, school's about to start, it's breakfast. I want 3 scrambled eggs, some turkey bacon, and some toast with jelly, and the person makes it right then and there for the kids when they come in?
Well, it wouldn't necessarily be scrambled eggs,
like that.
bacon, no. They can look on the menu to see what we're offering. We do have a cycle menu, and items are prepared on site. So we make fresh sandwiches, we make fresh salads, we cook burgers and chicken, baked chicken.
But not in real time, correct?
Oh, absolutely. That day, we're cooking the food that day for service that day in our full-service locations.
It's not made.
They still keep saying the food.
But it's not,
good.
right, it's
I'm
not
trying
made to
work-
order. It's not
Not
like
made
a
to
dine,
order.
no. Deli line is made to order. If you want to walk through the deli line, you can get a deli sandwich made to order.
Okay, thank you very much. I just asked that concept, hopefully in the future, we think about how we address food in our public school system, right? Obviously, if you go to some of the charter schools, to be quite frank, you'll see the level of flexibility where children are being fed, also being more sensitive to children's diets, right? Everybody don't eat meat, right? So is there an alternative for the kid that comes to school?
Absolutely.
Right? Yeah. And I just asked that concept because I have visited on the private school side of things where your food is made to order. And I guess that's what you get what you're paying for. But also I think thinking about this differently, and if obviously for some, they don't think it's working the way it is, right? And if there's a stigma of children getting a free lunch, I think that stigma might be different when it's a made-to-order type of meal, right? And I think it's worth the investment that we should do. I mean, the district has the largest budget beyond, what's the Philadelphia Police Department? Several $1 billion the Philadelphia School District receives. I know that for a fact, right? So I think we have to revisit and think outside the box, or as we used to say, maybe reimagine food programs for our students in our schools, and maybe they think about it differently in terms of, it is a clear point that some kids may think that there's a stigma that comes along with it, and oh, you get free lunch, that means you want public assistance, yada, 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 but if it's getting cooked made to order, it might be a different type of approach, and hopefully it tastes a little good.
Thank you, Council President. Disruption is the name of the game. We go to Council Member Ketsi Lazada, who's been waiting patiently, and we're trying to wrap this up so we can give you a little break and then go to the next panel, so go ahead.
Thank you, Madam Chair. I'm just gonna, I want to reiterate the fact that our children, when you ask them, at least in my district, why don't you eat the food? They say it's nasty, right? But I also want to put out there a recommendation that we've received, right? You have a school like Memphis Charter Academy that is under fire right now by the school district, right? But who have zero waste in lunch. You know why? Because those children are a part of the process around selecting lunch, right? They cook certain meals and they allow children to test them, and the children say, I like this chicken, I don't like that chicken, I like that pasta, I don't like that pasta, I want this hamburger, I don't like that hamburger. And when you do that and you offer children what it is they're a part of, they tend to eat it. And I don't know why we don't adopt that type of model.
So Ms. Keegan did mention that in a couple of weeks, we will have 900 students coming down to the district office for our seventh annual food show, where they will taste from about 30 different vendors, 50 different items that they will then rate, and that will appear on the menu because the students selected it. We also have.
So why do we have so many kids not eating the food? If they're a part of the selection.
I can tell you that over the last 2 years, our participation has increased a lot because of the steps that we have taken in engaging our students more in what it is that we are feeding them. We want them to eat, so we want to make sure that we are putting in front of them what they like, and the food show is one way. On the other side, and that's more so for the full-service locations that I was speaking of, on the other side, for the pre-plate, we do have what we call the VIP Taster Program, where they actually come into the school and they give them 5 different menu items that the students taste and they rate, and then those items, the ones that they liked, will appear on that menu as well. So we are actively engaging our students with surveys throughout the year, asking them what they want to see, what they don't like. Our NutriSlice app, which is our menu, allows the students to rate every item every day, and we use that information to build our menus as well.
So what is that data telling us? If you guys are rating them every day, what is it telling you?
The data it gives us a good insight into the items that are successful and the students do like. We are seeing that there is, an average rating on most of our items, so we are encouraging students to include information as far as because I've heard it before, students saying things are nasty, and I say, what makes it nasty, and encouraging them to tell us the things that they don't like about certain items to increase their awareness of vocabulary around food, and also to provide us feedback that we can actually use to put into the menu. So when they say something is crunchy, or those types of adjectives and those words, we're able to actually utilize that information to change our menu and adapt to what they give us in their feedback.
Somebody in their testimony mentioned that as part of the outreach, you all were going to work through community coordinators in the schools to be able to connect young people or families with just food. What are you doing in those schools that don't have community coordinators?
Well, we are working with the leaders, the administration in the schools, to identify students that might have more, that are going without food. So that's what I mentioned in the testimony, that we will be working with the school leaders to make sure that we are addressing their students that they have identified that have more of a need.
I met with some of the school district's administration. I met with some principals, I want to say a few days ago, right? And they're saying, we can't do more. We don't have the capacity to do more. There's no way that I can reach out. We were talking about truancy and direct communication with parents, and they say they can't do more. In a situation like the one that we're in right now, does the school district have the capacity to be able to identify someone in the school that will be that coordinator, that will be that person that is going to call home to say, hey, Michael didn't eat lunch today, he didn't eat his breakfast today, what can we do? Can you encourage him to eat? Is there someone that's going to be able to connect with mom and dad or with Michael to be able to make sure that he has something in his tummy?
We do have our Office of Family and Community Engagement that we will take that information back to understand how we can ensure the FACE coordinators for each of our networks, what type of outreach they currently do with the families, and ensure that we're including information gathering around students that may be facing the food insecurity. So thank you for lifting that up.
Councilmember Jones mentioned earlier that we don't want to throw food away. You guys say you don't throw food away, but I do have a school in my district that does throw food away, and community residents know that it goes in the garbage. Thankfully enough, there is someone in the school building that puts it in a way where folks can come grab it. How do we ensure that that food gets into the hands of community as opposed to it being, so the leftover food, right? You're saying that you connect with, I don't know, with members of food pantries. How do we, or how can we put it in a place or a space outside of that immediate school building where residents from in that community can actually benefit from it? Is there a way for us to do that? Is that, I know that somebody said to me, Councilmember, we're not allowed to do that. But how do you, that school figures it out, right? how do we ensure that that occurs across the city?
I would like to go visit that school to see what it is that they're doing and how they're doing it. But we would have to engage the school leaders. We would have to engage someone within the school to set up what you're asking and, you know, to allow the community to come get the food. It would have to be someone within the school working with the meal or with the food that was left over and putting it in a place where the community can come get it.
So there's nothing on the legal side that prevents us from doing that? That just has to be a policy or coordinated through the individual schools? Is that what we're saying?
Correct.
Okay, and so can we prioritize that? Can we work with each one of our schools to prioritize anything that's left over, anything that's extra, anything that's left on that shared table? Can we identify a space in every one of our schools that we invite community to come get that food?
We can certainly take that back to explore that option with our academic partners and see how best to implement it at all schools.
Thank you.
Thank you. Just the number 100 million is rotating in my head. And we want every bit of that 100 million to be used and utilized by our school population and support their families as well. So we're going to follow up on that piece. You have a question? Okay, Council President. Yeah, we have to keep moving.
I just have a real quick one that's really focused on the purpose of why we're here. You mentioned in your testimony of federal funding for SNAP Ed. Now, we talk about SNAP. And SNAP is only focusing on those who are using their EBT cards, but we're also losing funding for SNAP Ed, which will be eliminated. Therefore, potentially sunsetting the district team members and 6 external partner organizations at the end of 25-26 school year. So how will this loss of funding affect your Eat Right Philly program and broader nutrition and education work, and what is needed from City Council local partners to help sustain that particular initiative?
That's a very good question. So yes, so the district does receive SNAP education funding directly, and then I think in the next panel you'll hear from some of the partners that the district works with and that bring SNAP education into our schools. So there are 6 organizations that are doing that. And at this point in time, there is not identified, I guess, funding to provide that in the future. So it is a supplemental nutrition education program. So it is meant to enhance what's happening during the school day. So like I said, there's a lot of cooking classes, there's gardening. We do a lot of work around food insecurity, similar to what you're bringing up, trying to help support schools build their capacity to address food insecurity in the schools. So yes, that is something that I think the school district and the external partners can put their heads together and see. Like I'm sure you'll hear a little bit of that from the next panel as well.
Thank you.
Thank you, Council President. Thank you all for your testimony. I know we have some follow-ups because we want to make sure this food insecurity of the moment is overlaid by the data you already have of where this insecurity is and what school is in that space. And we need to move, and we cannot allow bureaucracy stand in the way of feeding people. I just want you to all think, how do we mobilize this? So it doesn't take 5 weeks to get a policy change around something like this. But we'll be following up, so thank you very much.
Thank you.
And we are running short of time. We have another hearing in this room. So I apologize, but we're not able to take the break that I thought we could. So I would like the clerk to call up the next panel. And I thank our stenographer who has been working tirelessly to do this work. So please, everybody, acknowledge our stenographer who is working tirelessly.
Mark Edwards, President and Chief Executive Officer of the Food Trust, Erica Lewis, the Caring Center, Mandy Booth, Chief Executive Officer of Vetri Community Partnership, and Jacob Zajcic, Community Advocacy Director for the American Heart Association.
And just for the record, I do know we have still from the administration, Department of Human Services, Commissioner Kimberly Ali.
She already done.
Who else would be and attendance. The administration is still here, and I also see Stephanie over there as well. Just for the record, in case y'all may have any additional questions that might need clarification.
Thank you all. Please state your name and begin your testimony.
Good afternoon. My name is Mark Edwards, and I'm the president and CEO of the Food Trust. I want to start by first inviting you to enjoy the apple at your place setting.
We were looking at this,
yes.
not sure we were supposed to eat it.
It's locally
There was
sourced.
no policy around it.
Yes, it's locally sourced from one of our farm to school programs, and so as you eat it, you can enjoy the health benefits of getting your vitamin C, your potassium, and your fiber. It's actually a good representation of who we are as an organization. We think of ourselves as standing between hunger and health. And so I sit here before you today not only as the president and CEO of the Food Trust, but many of my colleagues are here with signs and partners are here with signs. And I think we even have a carrot. That's joining us here today. And I also have the pleasure of serving as the co-chair of the City of Philadelphia's Food and Nutrition Security Task Force. And so thank you, Council President.
Thank you for your service.
Thank you. And thank you for your leadership. And thank you, Madam Chair. Thank you to the committee for hosting these hearings, putting these hearings on. It's very important for us. And so the Food Trust as an organization is focused on fighting for Philadelphians' right for healthy food for more than 30 years. As you heard today, the SNAP freeze has left families scrambling to put food on the table. And we're all rallying to meet the moment. But make no mistake, whether SNAP benefits return next week, next month, or next year, Philadelphia is in dire straits. 1 in 6 of us experience food insecurity, far above the regional and national average. And so we're caught in what feels like an endless cycle of hunger and hardship. The hearings proposed in Council President Johnson's resolution give us the chance to come together and build real, lasting nutrition security solutions that reach every corner of our city. Philadelphia's response must go beyond emergency food. Our city is dynamic, so our solutions must be multifaceted. Our city is diverse, so every sector must have a seat at the table. Our city is resilient, and so our solution must be tough enough to withstand any storm. In the short term, we know that we must ensure that SNAP-eligible recipients can access healthy food right now because it's urgent. The Food Trust's emergency food interventions focus on meeting people where they are, where they shop, protecting families' dignity to choose foods that they like to eat. With city support, we have scaled up distribution of our food bucks, and thank you to the City of Philadelphia for your investment in food bucks, and Councilwoman Ahmad for your support and your advocacy for our food bucks. These are coupons that families can use to shop at farmers markets, corner stores, and supermarkets, allowing shoppers lots of choices and supporting neighborhood retailers who rely on SNAP transactions for their economic livelihood. And at our farmers markets, we are fundraising for Healthy Food Mutual Aid, donating unsold produce to pantries and community fridges, and supporting farmers to host pop-up distributing fresh fruits and vegetables, not just to communities that we work in, but some that are specifically targeted to seniors. By working together, we can weather the storm. But emergency response alone, while it is very important and we support it, is not enough. We believe that nutrition is the bridge, just as that apple is, between hunger and health. I think that bears repeating. nutrition is the bridge between hunger and health. And we know that poor nutrition fuels rising rates of obesity, diabetes, and heart disease, and a $1 trillion toll on our nation's healthcare system and economy. To reverse these trends, we need a comprehensive approach to nutrition security that connects access, affordability, and education. We've heard a lot this morning about SNAP, and I think we all understand SNAP. But you also begin to hear in this panel discussion and the panel discussion before this one about SNAP education. Think about it this way. SNAP is the means, it's the money, and SNAP education is the know-how. And so, in order to reverse these trends, we again believe that a comprehensive approach to nutrition security is necessary and one that connects access to affordability and education. And so, unlike SNAP, which when the big ugly bill was signed, the resources allocated, the federal resources allocated to SNAP were reduced. In the case of SNAP education, the resources were not reduced when that bill was signed on July 4th. They were eliminated altogether, so that even when the government opens and or SNAP comes back, whenever that happens, SNAP education goes away. And so the know-how goes away. And so that threatens the health and livelihood of our city. And this program didn't just teach nutrition, it improved diet quality, reduced chronic disease, stretched food dollars, and supported local farmers and retailers. And so our city partners and our city partnerships and funding have amplified the fact that helping educators build lasting trust in communities that we serve is a very noble and important thing to do. Today, Philadelphia now has the opportunity and the responsibility to rebuild and sustain proven nutrition programs and signal to our residents that we're committed to their health for the long haul. I'm proud to be joined here today by my colleagues, many of those educators and partners, including the Food Trust, our own team, as I've indicated, and our Caring Center partners, who you're going to hear from shortly, who teach children where their food comes from, cook healthy meals in classrooms, and guide shoppers at corner stores and farmers markets. They are the heart of the work that we do. Without integrating nutrition education into food access strategies, we risk repeating the same cycle, where families get food, but not the tools to turn it into lasting health. However, if we combine immediate relief with long-term investment, putting nutritious food on tables today while empowering families to make healthy choices for years to come, we can move Philadelphia from hunger to health. So thank you.
We're going to ask some questions. Please state your name and begin your testimony. Thank you, Mark. We'll come back to you.
Hello, my name is Erica Lewis. I am the hospitality manager at the Caring Center. I've been there for 26 years, and I'm here to share my story and my experience with SNAP Ed. We really need SNAP Ed involved in our schools and our communities with our children. SNAP Ed is an amazing program. It has been a tremendous help and support to the Caring Center. It makes me nervous to think that we might have this program fully eliminated. Without it, my children would be greatly impacted. Without SNAP Ed, there would be no additional refrigeration and freezers so that my school is able to purchase multiple cases of fruit and vegetable for lunches and snacks. In the past, we only had enough room for 2 cases of vegetable or fruit fresh. But after receiving a grant from SNAP-Ed, we were able to purchase more refrigeration. Now we serve fresh fruit and vegetable every day with at least 2 of the 3 meals that we serve. Without SNAP-Ed, we wouldn't have the funding to help us be able to afford local produce. Through programs such as the Quarterback Grant that gave us a quarter for every meal that was served to every child that contained a PA local fruit or vegetable, we not only benefited, but PA farmers benefited as well. There were other grants like Farm to School Institute that helped build our own garden, where my children learn how to plant a seed, water it, watch it grow, harvest most of it, prepare it, and eat it, but also be able to go back and harvest seeds that we can plant for the next season. We were also able to reach out to our families and community in the Mantua section of Philadelphia. Farm to School Institute has had a part of the grant where we had to involve our community, in which we purchased boxes of local fruit and vegetable to give away to our parents and our neighbors. Programs like Food Bucks for RX and Cooking Beyond the Classroom and Center cooking activities with Miss Erica help children try new fruits and vegetables, and also it enabled them to bring local produce home. Food Bucks gave us a stipend for farmers markets and co-ops so that parents could take their children and go shopping for items to consume at home. I remember one parent, she was really excited. She wanted to know if she could join the program twice because they were able to purchase berries, something that they didn't often have in the home. But she was like, everybody was so excited to have strawberries and blueberries, and it was just like, you know, it was amazing that the program was able to provide that for them. Also, Cooking Beyond the Classroom gives you everything that you need to prepare a meal with your family. So they were able to bring what they were learning at school when they cooked with me home as well. This program, Cooking Beyond the Classroom, gives them the food that they need to make up a recipe, and then they prepare it with their families. Children cooking at school helps them to try things they might normally wouldn't pick up. I had a young man, his name was Donald, and we were doing I believe it was a health salad that we were preparing, and it had rainbow carrots in it. And, you know, I have these special knives that they use, and they cut up their carrots and broccoli and everything, and they put it in their health salad. Donald, we had to get him to, like, come on, Donald, you made this, try it. And he tried it, and he liked it. So much so that when Donald was, I think he was about 18, he came back to visit the center to say hello. And he said, Miss Erica, you know I like vegetables because of you. So, I mean, it just made me feel really good that what I was doing wasn't in vain. We really need this SNAP-Ed program to help our children, to help our families, to help our communities. Thank you for your time, and thank you for listening.
Thank you. State your name and proceed with your testimony.
My name is Maddie Booth. I'm the CEO of Veterinary Community Partnership. Thank you to City Council, President Johnson, and members for convening the Food and Nutrition Security Task Force, of which I'm a proud member. To City Council for their increased interest and attention to food and funding issues impacting our community, and to the Public Health and Human Services Committee, including Chairwoman Ahmad, for hosting this hearing. We are proud to operate in Philadelphia with a mayor and city council who govern with care and compassion for neighbors. So thank you so much for what you're doing. As I mentioned, I'm the proud CEO of Veterinary Community Partnership. We're a Philadelphia nonprofit that nourishes minds, bodies, and communities with nutrition education through cooking. Veterinary Community Partnership offers hands-on cooking and tasting opportunities featuring recipes that are nutritious, vegetable-focused, affordable, and most importantly, delicious. Our cooking workshops are interactive, they're welcoming, they're hands-on, that empower people of all ages from kids in kindergarten through senior citizens to build culinary confidence and increase nutritional knowledge. Our nutrition education services take place in schools, health and community centers, and in our own teaching kitchen. Each year, VCP reaches nearly 30,000 community members of all ages and backgrounds. We are also one of 22 Pennsylvania SNAP-Ed providers and one of 9 partners serving residents in Philadelphia. Our SNAP-Ed team of 9 offers hands-on cooking classes, fruit and vegetable promotion for kindergarten through 8th grade students at 16 schools during the school day, and creates about 16,000 experiences for students annually. This accounts for over half of our organization's total reach. SNAP-Ed is, as you've heard, the nutrition education and promotion arm of the USDA Supplemental Nutrition Assistance Program and a cornerstone program to protect and increase food security. SNAP-Ed is an effective, community-centered tool that addresses food insecurity, nutrition inequity, and chronic disease prevention, especially in under-resourced communities. Using a variety of evidence-based public health approaches, SNAP-Ed strengthens schools, community organizations like ours, and households by equipping people with the knowledge, skills, and confidence to make nutritious choices and make lasting changes within a very limited budget. With the elimination of SNAP-Ed funding, our ability to provide the scale of services to which our neighbors and school partners have become accustomed to will be significantly diminished. These cuts could deepen health disparities, will undermine years of progress, and force organizations like ours to scale back at a moment when we should be scaling up. With this loss of funding, community-based organizations will also need to likely lay off highly dedicated employees who spend their days in schools providing hands-on cooking classes and exposure to fruits, vegetables, and whole grains. It's also worth noting that after this year, Veterinary Community Partnership will receive 0 government dollars, no local, city, state, or federal funding for providing nutrition education through cooking services. The ripple effects in our community could also be quite significant, especially paired with these cuts to SNAP dollars. One goal of SNAP-Ed was to help folks stretch already limited food budgets and to support their families' food consumption and intake. Our neighbors and communities will need more support accessing food and also accessing nutrition education because they go hand in hand. In our programs, we see a lot of students enjoying something for the first time, whether it's a fruit or a vegetable new to them or just prepared in a new way. I thought it was mine. We hear some participants saying, "I can cook now," and feeling confident, engaged in, and curious about cooking at home. One of our SNAP-Ed educators heard from a Philadelphia parent whose son Henry had taken part in his school's SNAP-Ed nutrition education classes. After just a few sessions, Henry was already making changes at home. He prepared a veggie tray appetizer for his family, he set the table, and he served water instead of soda. It's a small moment with big implications. When kids like Henry bring these lessons home, families eat better and health outcomes can improve. And the numbers bear this out. SNAP-Ed costs just $5 per year per beneficiary, and for every dollar invested in SNAP-Ed, nearly $10 can be saved in future health costs. Cooking is an essential life skill, and one that increases the likelihood that accessible foods reach the bellies of our kids and our neighbors. Research shows that self-perceived cooking skills, believing that you are a capable or a good cook, lead to individuals making more nutritious choices for themselves and their families. This is particularly important in Philadelphia, where data has shown that kids eat fewer than 1 serving of vegetables a day. Diet-related health conditions like hypertension and diabetes also impact adults across this city. While we can't prevent and manage disease entirely through cooking and nutrition, we can certainly help people gain the skills and the confidence to cook and eat well. By working with participants on honing skills from reading nutrition labels to dicing vegetables, community members leave Vetri Community Partnership classes feeling empowered to include nutritious ingredients in their daily lives. Plus, people of all ages get the opportunity to cook and taste new ingredients, preparations, or dishes without the risk of wasting their money or their food. Also, it's really fun. Thank you for your interest in promoting the health and well-being of all Philadelphians. As you consider the future of food and nutrition security in our city, we ask that you champion the restoration and protection of nutrition education funding and invest in programs that build a healthier Philadelphia for all. Thank you so much.
Thank you so much. We need every child to have the potential to be Henry. Yes, we hear you. My children used to cook with us when they were little, and they now cook and eat vegetables because of exactly what you said. And that's a Montessori approach to empowering young people, and we should really integrate that into our school systems, especially in our kindergarten spaces. So thank you for that. Oh, sorry, I didn't realize Jacob's. Go ahead. Apologies, Jacob. I wanted everybody to be done before we started talking. Please go ahead.
No problem. Jacob Zaitchik, I'm speaking on behalf of the American Heart Association, and thank you for the opportunity to provide testimony here today. Heart disease is the leading cause of death in Philadelphia. The American Heart Association is focused on providing evidence-based strategies for parents and caregivers to create a healthy food environment for young children that supports the development of positive eating behaviors and maintenance of a healthy weight in childhood, thereby reducing the risks of overweight, obesity, and cardiovascular disease later in life. The American Heart Association believes that the Supplemental Nutrition Assistance Program, SNAP, plays an important role in addressing health and hunger among families with low incomes, and the association supports SNAP access and funding to address food insecurity and improve health. In July 2025, Congress passed a budget reconciliation bill that included major changes to SNAP and SNAP-Ed, including stricter work requirements, reduced eligibility, funding cuts, and the elimination of funding for SNAP-Ed. The federal government shutdown that began on October 1st has put benefits even further at risk, with nearly 100,000 Philadelphia residents projected to lose SNAP benefits in November if the shutdown continues. Those changes and current lapses of federal funding will make it even more challenging for the nearly over 900,000 Philadelphians who live in areas of overabundance and unhealthy foods. Mayor Cheryl Parker's executive order on November 1st is an important step to immediately help the nearly one-third of Philadelphia's population impacted by the lapse of federal funding for SNAP. But we also must begin to work on a citywide, long-term approach to nutrition security centered around equitable health outcomes and sustainability that includes stronger coordination between the city, nonprofits, hospitals, and schools. The American Heart Association has collaborated with city government and community stakeholders to develop and implement innovative strategies that address nutrition and access to healthier food. That includes expanded access to nutrition incentive programs like Philadelphia Food Bucks, incorporating our science and research to support the development of nutrition standards for city government agencies, and direct capacity development and support for neighborhood organizations and community schools to provide healthier food options. The American Heart Association is supportive of evidence-based programs and initiatives that remove barriers to access and affordability for families to purchase fruits, vegetables, and other nutritious foods, like the Food Bucks program, which has been active for 15 years. Nutrition incentives support a triple bottom line, helping families bring home more nutritious foods, supporting Pennsylvania farmers, and keeping more food dollars in the community. Nutrition incentives empower families to purchase healthier food options by making products more affordable. The Food Trust has documented numerous positive impacts of this initiative, including improving fruit and vegetable consumption, increasing SNAP sales at farmers markets, and bringing revenue to regional farmers and family-owned retailers. The American Heart Association is also supportive of produce prescription programs that can cause greater collaboration between healthcare providers, neighborhood retailers, and community partners. Produce prescription programs enable doctors to prescribe fruits and vegetables in addition to medications. Patients receive electronic cards or vouchers to access free or discounted produce of their choice at retail, grocery, or farmers markets. Produce prescriptions were associated with significant improvements in fruits and vegetables intakes, food security, and health status for children and adults. The Philadelphia Department of Public Health has played a significant role as a convener and implementer of innovative strategies to remove barriers to healthy, nutritious food. By leveraging and potentially even expanding current initiatives like Philly Loves Fresh and the Philadelphia Food Justice Initiative, the city can provide additional support to community organizations that are serving in neighborhoods where demand far exceeds the current capacity to be provided. The American Heart Association serves on Council President Johnson's task force to address nutrition and hunger. The current efforts led by Mayor Sherrell Parker and the City Council are important to support families in need. We must begin to plan a sustainable citywide approach to address nutrition insecurity and incorporates both innovative solutions and proven effective evidence-based programs. Thank you so much for the opportunity to provide testimony. I just wanted to add one thing. We did share this with staff and we'll circulate it also. It's a list of some of the direct community work that we are doing to address nutrition security. Since 2020, we've partnered alongside 52 food pantries to increase their capacity and really ensure that they're providing healthier food options. That's in addition to some of the work they're doing in even some of the surrounding counties. So definitely excited to participate moving forward too.
Well, thank you so much for all your testimony, important testimony that tells us what is working. Having worked with you on the Food Bucks program, and I was very proud to be able to support that. And watching that in action was really illuminating that we should have it in every corner of Philadelphia. The fact that people are able to get their SNAP-Ed piece done and figure out what to buy in the grocery store with their Food Bucks, and the grocer is getting revenue as well, and also changing what produce what they're putting out there for their customers. So this is a culture shift, a change in how we do, so we move away from all the packaged and preservative and packaged food, and make sure we see it everywhere, particularly in our schools. This is our youngest Philadelphians who need to have that culture shift in what they're presented with in terms of food. So, you heard us have the conversation with the school district. This has to be real, and this has to be actionable so that we can see more Donalds and, I forget his name now, who are going to try new things and make it a part of their lifestyle, and helping their families have culture shift as well. So I thank you so much. I wanted to ask a quick question about these, the Food Bucks model to infuse resources in there. Could that meet the need of the SNAP cessation? Could you speak to that, Mark?
Yes, and as indicated in my testimony, that's precisely how we are using some of the investment that the city has made so that we can offer up what we refer to as community bucks, and that is to say there are no cash requirements associated with matching it. You can take that voucher and go directly to a retailer and purchase fresh fruits and vegetables.
So the money that we are just talking about could actually be deployed in this manner?
That's correct. We're making an application for that.
Okay.
So yeah, we hope.
So this would also get the grocer to get revenue as well.
Correct.
Right, as they're doing this. So
that's correct.
A win-win in terms of keeping the food ecosystem going with directing some of the dollars into this way of addressing the lack of SNAP benefits.
Yeah, and I would also add too that with continued investment in this way, hopefully as the years go on, there are opportunities at the federal level for us to be able to match federal, these bucks that we refer to as food bucks, they're also referred to as incentives. And so there's an opportunity for us to match our local investment with federal investment one-to-one. So if this, City of Philadelphia invests $100, we can get $100 from the feds, or apply for $100 from the feds.
Okay, thank you. Anybody has any questions?
It's going to be brief. I just want to thank you, Mark, for your leadership with the Food Security Task Force. Thank you, Jacob, as well, for your participation, and also educating me around the whole dynamics, not just SNAP, but overall how we look at and address food security, as well as the education component, because it's key to change habits, right? When you look at nutrition, you look at health, and also how our lifestyles, if we address certain things in a positive way, can prevent a variety of different illnesses down the line. And so I just want to thank you for just your leadership around this particular issue. And say your name again from the Caring Center.
The Caring. Erica?
Erica. You keep, no.
No.
What's her name?
She has
Oh,
a
okay.
hearing.
I just want to personally say, thank you. I've known you for years. When my boys attended the Caring Center, and you're still on the same mission. Right, so you keep up the good work and very powerful and informing testimony.
Thank you. All right, thank you so much for your testimony. If we can have if the clerk would call up our last panel. And thank you for your patience.
Dr. Senbagam Verudachalam, pediatrician and policy lab faculty member at the Children's Hospital of Philadelphia, Kate Coyer, regional program director for Greater Philadelphia at Food Connect, and Chris Bolden Newsom, co-director of Sankofa Community Farm.
Please state your name and begin your testimony.
Good morning. Good morning, or good afternoon now, yes.
It's been a long day, yes. Thank you for your patience.
Yes, good afternoon, Council President Johnson, Chairperson Ahmad, and members of the committee. Very, very grateful to you for calling this hearing and just to be able to share this testimony with you today. My name is Dr. Senbagam Verudachalam, and I am a general pediatrician at the Children's Hospital of Philadelphia and an assistant professor of pediatrics at the University of Pennsylvania. I'm also a member of the Food Trust Board of Directors and City Council's Food and Nutrition Security Task Force, and I'm the granddaughter of small family farmers, the daughter of immigrants, and I was raised in the Midwest. All food traditions through my upbringing have really shaped me, as I'm sure they have all of us. It's just to pause for a moment and think about how hungry we all are right now, right? And for those of us that broke the rules and bit into that apple, how much relief we felt just to have that little bit of sugar, a little bit of nutrition, right? And so that's what really brings all of us here today. I have been a pediatrician for nearly 20 years, more than 15 of those in Philadelphia. I'm also a scientist. I study nutrition, health, and the systems that reach children and families. In my clinic this week, nearly every family I have seen has shared that they do not have enough money for food. I have never before in my career seen this level of need. Food is really a fundamental manifestation of love, nourishment, and compassion. Every child and every family deserves to have enough food and to have nutritious food. One argument I often hear in a crisis like this one is that it doesn't matter what food we provide to hungry people. We just have to give them something. I would posit that especially in a crisis like this one, the type of food we provide and where it comes from matters a great deal. The lack of SNAP funding will also have an enormous impact on our local economy, as we've just heard, with tens of millions fewer dollars being spent on groceries. This lost revenue is going to strain farmers and vendors who produce and sell food, eventually making it economically untenable for them to continue to provide food as they currently do. And ultimately, all of us will be impacted, not only those who depend on SNAP. The last several years have shown us how fragile our food system is, and periodic emergencies may be the new normal. To weather this crisis and those that follow, we have to ensure that every Philadelphian is connected to a strong and resilient local and regional food system. What does this mean, practically speaking, and why is it important? In order to thrive, children and adults must eat mostly whole plant foods. So that means vegetables, fruits, grains, and beans. Americans as a whole don't eat anywhere near the recommended amounts of these foods. One study in 2021 showed that half of 1 to 5-year-old kids in this country were not even eating one vegetable a day, let alone multiple. The current food system, which contributes to at least a quarter of all greenhouse gas emissions, offers abundant, processed, highly palatable, and cheap foods, and at the same time makes fresh, healthy foods inaccessible and unaffordable. And this ultimately affects eating habits across generations. As a result, many people have replaced eating whole, fresh foods with high fat, high sugar, high salt foods that cause illness instead of supporting health. We do have reason to hope. Philadelphia and Pennsylvania have an abundance of natural resources and the capacity to grow food nearly year-round. There is a thriving grassroots network of farmers markets, urban farms, and community gardens in this city. And the people and nonprofit organizations who have built this network have worked very hard to ensure that it reaches all Philadelphians, especially those with low incomes. We need city-level and institutional support to strengthen and expand the breadth and reach of this system, both during this crisis and going forward. The Food Trust, as you just heard, has invested a great deal in ensuring that fresh produce is available at farmers markets and corner stores throughout the city. The Food Bucks program is amazing, and I think that I agree that expanding it in this moment of emergency is a really incredible way, not only to bring food dollars back to local farmers who need it, but to provide people with the ability to get food in a dignified way at the places where everyone else shops and choose food according to their family's preferences. The city should support farmers markets that bring local and regional produce to every neighborhood in the city year-round and provide subsidies in an ongoing way to low-income residents to purchase this produce. Healthcare providers also have a critical role to play. Like all my physician colleagues, I took an oath at the start of my career devoting myself to this calling. The Hippocratic Oath states, "I will prevent disease whenever I can, for prevention is preferable to cure." Healthcare systems, including insurers, must help ensure that families feel they can make use of available, fresh, whole foods to ensure food security and prevent and treat diet-related diseases like diabetes and heart disease. At CHOP, I've led the development of a program called Home Plate, which is a family-based group virtual food skills program that has shown improvements in young children's diet quality and household food security in 2 randomized trials. Home Plate is a 6-week-long program, and we use shared cooking to build community connectedness and practical skills to support food security and healthy eating habits, especially among families with limited resources. I want to share just a couple of quotes from the evaluation that we did of Home Plate, really to bring families' voices to what this program meant to them. One parent said, "I was so happy to meet some of the other ladies and hear their stories and share mine and just let my hair down and have a little bit of fun. It's been a struggle. I've been dealing with life lately, so it's been a really good experience. Everybody is laid back. We could talk comfortably, laugh. Everybody did something different too. It made it fun to see everyone else's dishes." Another parent shared, "I enjoy it because my little one, she gets to pick out certain fruits and vegetables she likes. She even helps me cook it. So as far as her eating skills, it's gotten a little better because she gets to taste test all the different fruits and vegetables. So it's good for her, and I like it too, cooking different foods." And that parent was referring to being able to pick out fruits and vegetables. That happened through a partnership with the Food Trust, where we were able to offer produce prescriptions to families. The city really needs to invest in programs like this one to ensure long-term food and nutrition security for children and families. To further strengthen the local food system and support the health of its citizens, the city and its anchor institutions should source sustainably grown local and regional produce to be served in schools, hospitals, universities, and other institutions. Philadelphia's urban agriculture plan, called Growing from the Root, which was published in 2023, provides a 10-year roadmap to enact such policies. I encourage every member of council to support actualizing this plan through allocation of funds and coordination across city agencies. Stronger local coordination between the city, nonprofits, hospitals, and schools could really reduce our reliance on federal programs and protect us during crises like this one. We must meet this moment with every tool at our disposal and ensure that we're better prepared for future emergencies. Philadelphians deserve to eat fresh food that tastes good and nourishes their bodies and minds. Regardless of income, every Philadelphian should be afforded the dignity of choosing fresh foods that meet their preferences. We need a long-term strategy to ensure food and nutrition security for all Philadelphians that centers people and the earth that sustains us. Despite the crisis that we're now in, I remain very hopeful that we're going to find our way through this moment and emerge stronger and more connected to one another. Thank you.
Please state your name and proceed with your testimony.
Good afternoon, and thank you for the opportunity to speak today. My name is Kate Collier, and I'm the Senior Regional Director for Greater Philadelphia at Food Connect. We are a local logistics and technology nonprofit working to bridge the gaps in our food system to build healthier communities. Food Connect was founded by our CEO, Megha Kolstresta, who grew up in a family that relied on social safety nets to survive. She built this organization to make those systems stronger, faster, and more equitable, especially in moments of crisis like this one. Since 2014, Food Connect has focused on the hardest part of getting food to people who need it most, commonly known as the last mile. That's the final stretch of connecting food from donors, warehouses, community partners, directly into the homes of families, seniors, and residents who can't easily reach traditional food pantries. Today, we deliver over 250,000 meals each month across 70 cities nationwide, including right here in Philadelphia. Each month in our city, we complete more than 800 home deliveries for families through CHOPS Food Pharmacy program and distribute over 1,300 food boxes to seniors through the Commodity Supplemental Food program. We're also honored to be part of the One Philly Produce Project, an initiative led by Mayor Sherelle Parker and the Mayor's Office of Education and the Office of Children and Families. This project brings together multi-sector partners to distribute fresh produce to all community schools, ensuring children and families continue to have access to fresh, healthy food. With the federal SNAP funding lapse creating uncertainty for millions, Food Connect has activated our rapid response infrastructure to ensure no one in Philadelphia goes hungry. We're working daily with city agencies, food banks, and local organizations to expand delivery capacity, track food flow, and ensure meals reach homebound residents within 24 to 48 hours. In October alone, we delivered over 200,000 pounds of food across the Philadelphia region, which was a 23% increase from our average volume monthly. We also want to recognize the incredible coordination happening across the city, fueled by the Food and Nutrition Security Task Force, which we are a member of, and by Mayor Parker's leadership through the One Philly SNAP Support Plan. We especially applaud the city's launch of the Emergency Food Security Grant Program, offering micro-grants through a simplified 2-page application and swift review process. This mirrors the community-rooted rapid relief model Food Connect has been recommending, and we're encouraged to see these principles reflected in city policy so quickly. As we look ahead, we urge the city to keep building on this foundation. Food Connect recommends 3 priorities to strengthen long-term readiness. First, direct relief stipends, so families can buy the food they prefer from local stores, preserving dignity and choice while supporting small businesses. Second, community-rooted rapid relief, sustaining a standing fund, centering systems-level solutions by supporting both large food banks and smaller independent organizations that serve millions outside of traditional networks. And third, real-time feedback and data, using live community input and partner updates to ensure every decision follows evidence and the community's voice. This crisis reminds us that while our safety nets may be fragile, our communities are strong. Philadelphia's swift, coordinated response shows what's possible when government, philanthropy, and community organizations work as one. Food Connect stands ready to keep serving, coordinating last-mile deliveries, supporting data and feedback systems, and helping design equitable funding models so every household in Philadelphia has access to nutritious food, both now and in the future. Thank you.
Thank you. Would you please state your name and proceed with your testimony?
Yes. Good morning. My name is Chris Bolden Newsom, and I'm the co-director of Sankofa Community Farm at Bartram's Garden in Southwest Philadelphia. First and foremost, giving honor to the Almighty and to our ancestors, I want to wish a very good morning to all of my sister and brother workers out here, activists, faith leaders, farmers, and of course to you, the city fathers and city mothers, our city council people, and wish you all continued blessings. I am, as I said, Chris Bolden Newsom, and I'm a co-director alongside Ty Holmberg at the Sankofa Community Farm at Bartram's Garden, located in sunny Southwest Philadelphia. And I'm the manager there, the farm manager at Sankofa, where we run a 4-acre urban farm that focuses on ancestral foods, specifically ancestral foods of the U.S. South, of Africa, and the Caribbean. We serve the lower King Sessing area in Southwest Philadelphia through 2 weekly farm stands in 3 different locations, a community garden, regular classes, neighborhood garden bed programs where we go and actually build garden beds in the front yards of our neighbors in Southwest, and a 25 student strong youth farmer intern program, as well as a culinary culture program. So we're doing a lot. I want to just stop right there for a second and just say that I was rocked by the third panel a little bit, in which all of those discussions were coming out about the waste in food. I didn't even know if I could get up and continue to talk, I want to be honest, because there was so much to think about, right? So what it reminded me is that education is absolutely key. And listening to Dr. Sinbagam's words as well, to the fact that Americans don't eat vegetables. I think there's a lot to be done. And so what our farm and our community is doing about it is providing these education opportunities and education programs. They are crucial. Otherwise, you can throw all the food that you want at people. And I will tell you all that nobody wants to talk about this. And we can find 100 different reasons why food isn't eaten and why it's left on the plate, and yet we're still saying that people are hungry. I remember seeing boxes laid out on the street during COVID with the commodity foods, and it was because people didn't recognize it as food. Now, that's, I think that says a lot about where the culture is going and what we who are responsible have to do about that, but also, too, about education. So that, for me, is really important. But in Southwest Philadelphia, it's about 76% African descended. Most adults are employed, according to the statistics. But over a quarter of our residents live below the poverty line. Over a quarter. And many are managing chronic illnesses as they're raising their families. So about 40% of our customers at our farmers market use SNAP for purchases. That's been an increase, so that's a lot. That's a lot of SNAP, and that's where we're at this point. SNAP presents working poor families in our neighborhood as steps towards sovereignty in their food decisions. Many of these families that our farm serves are cash-strapped and having the freedom of choice, and you mentioned choice around being able to buy what they prefer, but having the freedom of choice in their SNAP purchases allows them to choose fresh, local, and chemical-free food, fresh from the farm, over what they might find in the very few grocery stores in our area. Our farm sets up markets in 3 different locations, as I mentioned earlier, throughout West and Southwest Philadelphia to help our neighbors have access to the diverse variety and high-quality and affordable produce that we grow. Full-service grocery stores in our area of Southwest are rare, and they're not often in easy walking distance. They can't be the solution. Grocery stores and corner stores cannot be the only solution, I will repeat. In fact, one of the major 24-hour grocers in our neighborhood recently closed, leaving hundreds of families now without food stamps since the decision over the weekend, and now without an accessible place to use any of the remaining funds on their cards. So for our majority of our African American neighborhood, the trauma of generations of systemic injustice, de facto segregation, economic and healthcare apartheid, all of that gets to be addressed in small but powerful ways when folks can go and make their purchases with SNAP. We can't imagine if we haven't been in the situation what it means to be able to have even that sense of agency over what you feed your children, right? When you don't feel that you have that agency in other parts of your life. And so these SNAP benefits are so helpful to our neighbors, especially to our elders who can purchase with their SNAP benefits the seeds, plants. A lot of folks don't know this. You can buy seeds and food plants with SNAP. Let me remind everybody, y'all, SNAP was a USDA program. And so it was set up for farmers to feed their families when they weren't making enough to be able to do so. I want to remind everyone it was a program for poor farmers originally, which means that you can buy seeds and plants, right? So there is an element of sovereignty to it. Let's promote that. Sankofa Farm at Bartram's Garden has been blessed to be able to accept SNAP benefits at our weekly markets for now over a decade. Every season we've seen an increase in the purchases using SNAP. What once was a little trickle of users barely acquainted with farmers markets became now a significant part of our farm's earnings. And with these cuts, how will our people get fresh, local, healthy produce to nourish their families and to continue their cultural heritages? Our farm has a yearly Thanksgiving U-Pick event where neighbors come and they can pick their own holiday greens for a small fee, fill up a bag. We've come to rely on our ability to help our neighbors, especially our seniors and families, purchase these the best quality chemical-free produce for their holiday kitchen. And now what I'm praying about is how we will serve those people in the next coming weeks. We've already increased our donations to feeding sites. And we may have to use some of our earnings at higher income markets to supplement our neighborhood sales. We are looking for solutions right now. And if we can be creative with what little we have as a small farm in Southwest, I know that you, our city fathers and mothers, can figure out how to provide significant support in the most creative and legal ways possible. The drastic and inhumane cut to SNAP while the Washington administration sends billions to prop up other causes in other countries is an affront to the dignity both of our nation in general and of the working poor, especially our elders and our young people. I want to keep the light on for our elders who keep our economy going and who absolutely depend on SNAP funds to eat every day. As farmers, we've been quietly feeding our city for 14 years, and I ask you, what would it take for our city government to fund feeding sites, to purchase healthy food during this crisis? What would it take to support our city's farmers with reasonably accessible funding to offset reasonably accessible funding, to offset the cost of fresh local produce that we sell? And what would it take to provide employment opportunities for young families to supplement their lost food funding and the effects of other cuts that are on the way? What could it take to incentivize the million and billion-dollar industries that call Philly home to help in this effort? I don't know all the ways, but I know that we elected you in part for your wisdom. And I believe in that wisdom. And so I invite you all to be courageous in your wisdom. I invite you all also, too, to think about the ways that we can support education. I thank you for the words that have come before that are speaking to this, because it reminds me that all the food in the world means nothing if you don't know how to use it, if you have been estranged from a generation or two from the kitchen or from fresh food. So we have to do a little bit more than just providing money, be it food bucks or other supplements, or even just fresh food. So on behalf of Sankofa Farms at Bartram's Garden and the families that we serve, I thank you for your time and your careful consideration of our words.
Thank you for your testimony. I appreciate all of you. Council President? Oh, before that, I just want to acknowledge our colleague, Councilmember Driscoll, who's joined us. He's part of our committee.
I just want to personally just say I thank all three of you for your participation on the task force, dedicating your time, your expertise, your information, and most importantly, your commitment to this issue. So I just want to publicly acknowledge you. I know it's a lot of hard work, separate from the work that you're doing day in and day out. And so again, I have to remind everyone who are here, this is the last panel, we're going to public comment. We've been working on this issue, and this is just something we're addressing in a moment in time. We have to come up with a concrete strategy, a long-term plan to address the issue of food security. And I thank you for being a part of that solution and that process. And we'll work in partnership with our mayor and the administration to make sure we have a long-term plan to address this issue. Thank you very much.
I have a question about, to Kate Collier, about the last mile, covering the last mile. I'm wondering if this model of covering the last mile, meaning having an Uber-like resource to deliver food, obviates the issue around, people having the ability to come to spaces, or even the shame associated with having to go to a food bank. And if there's a relationship with those who have the produce or the food, like the Sankofa Farms, is there a way to actually get it to people through sort of the system you mentioned?
Absolutely. It's a great question, and it's what we do every day. Our last mile home delivery work has been truly a growing effort since the pandemic changed the food system, and we pivoted how we serve our community. And the examples that I gave in the testimony today are just a small snippet of the home delivery services we already provide. I think you're absolutely correct that one of the biggest barriers to food security is transportation, and our pantry system is doing their absolute best, but they sometimes operate in hours that aren't convenient for the families who are working 2-3 jobs and need access to that food. So being able to partner with even more organizations through the amazing grant program that the city just released would be a way we would absolutely be more than willing as Food Connect to show up in our local food system here and coordinate more home delivery.
So you serve 800 families, you said, currently?
And that's just through one of our partnerships. We do
Okay.
we do numerous food as medicine programs and home delivery through that work with lots of healthcare systems here in the region, Temple Health, Mainline Health, some CHOP primary care sites in the surrounding suburban counties, as well as the CHOP food pharmacy program here in the city. So we have a lot of capacity to meet the needs through home delivery and do that in a very innovative, creative manner right now to meet the urgent needs, just like we did in the early days of the pandemic.
I can imagine our city folks who are dispersing the money to be connected to, anyway, it can be done, it sounds like. I wanted
Absolutely.
to just talk about the prescription that, what did you call it, pharmacy?
Produce prescription?
Yeah.
Produce prescription.
What exactly do you designate in that prescription? And would a Sankofa Farms be a place where people would go to get that? Or do you give choices? These are some places you can go to get this food prescription filled, basically.
Right, so the produce prescription program is run by the Food Trust, and we partnered with them. And so there's Food Bucks, and then Food Bucks RX is the produce prescription program. And those can be redeemed in large part at all of the places where Food Bucks can be redeemed. So that would be many farmers markets in the region, some corner stores, grocery stores. It's a wide network.
And so that sort of narrows, because it's prescriptive,
Yes.
they have to get those products, right?
Right,
So,
right.
So that's good to know.
Yes.
And in terms of the Sankofa Farm, Mr. Bolden Newsome, are you connected to sort of an infrastructure of our urban farms who might be all in a space where if we connected in the right way to create a network where we are connected through maybe Food Trust to spread this at this moment in time, are you part of something like that, or are you operating independently in terms of whoever kind of comes and finds you?
No, wouldn't that be difficult? No, well, I'm glad you asked. We are connected to several networks. Of course, my colleagues here at the Food Trust, we are a long-standing vendor at the Food Trust.
Excellent.
And a participant in many of their programs, including the Food Bucks for many years. I don't think that I've gotten any prescription RX yet, but I do know about the existence of the program, as well as, and I brought a little bit of swag about an organization that we belong to called SWAG, which is Southwest and West Agricultural Group. And that's a collection of farmers, city farmers in West and Southwest Philadelphia that come together to go jointly for resources, to share information as well as education sessions. And finally, another network here in the city that we're connected to is the Black Farmers Market, which is in conjunction with the Black Farmers Co-op, happens on 52nd Street every second and fourth Saturday.
Last question. I know we are waiting to go to public comment, and another hearing is supposed to be scheduled here. You mentioned unfamiliarity of people with healthy options, right? What would you, from your perspective, it's a cultural shift, it takes time, but what are some things, as we are meeting this crisis, we can put those things into action right now, right? what can we do to start and really amplify exposing people to different options and making these foods more familiar?
Yeah, absolutely. I mean, I think certainly we don't have time to go into all of the details of it.
Yeah.
But one of the most important, of course, is education. Education. You mentioned it's a cultural shift. It is a culture shift. It is a culture shift that is addressing a previous culture shift in which we moved away from real food. Let's just call it real food.
Yep.
In which we moved away from real food to what the expectation is now. And if the reason that our young people find the food nasty, that's a word we prohibit, by the way. We like them to say, I don't like it or I like it. It's because if you've grown up and you've been addicted to the sweets and the sugary and of a Kentucky Fried Chicken or a McDonald's or whatever, of course real food is going to taste strange to you. It is. That's not what you were nourished on. So I think that starting and supporting programs that are doing on-the-ground education, we do it through the way that feels most important to me. I am from the Mississippi Delta originally. I thank God I grew up with a deep and connected food culture that I took for granted and even once was embarrassed by. Many of you who are probably from other, intact food cultures and immigrant food cultures might be able to sort of relate with that. But I took it for granted, and when I came up here and saw that it was such a different story with my black brothers and sisters here in the North, having abandoned their traditional food. They came here with traditional food ways, and they lost them or gave them up. I don't know what the story was. I wasn't here. But what I do know is that the approach that we use is to go through that. We teach folks, first we reacquaint them with their traditional foods, which for many young Philadelphians, and that was a shock to me, they didn't know they had a traditional food. What's your traditional food? It's whatever sold at the Chinese restaurant, right? That's not your traditional food. So we go that route. And we do that by working, we have some programs in which we've worked in the past, worked in schools. We do sort of an education series during the winter with young people where we actually teach them to prepare some versions of their traditional food, give them the history, give them the background, then let them eat. And I will tell you this, and that everybody here has echoed this, what kids help to prepare, they will eat it. I have found that hands down, my son is 9 years old. Of course, he doesn't get much of a choice about what to eat. But, in general, I know that you can tell the excitement. It's different when Poppy makes the food and puts it out. But if he had anything to do with it, it's the best thing in the world. So education and get them involved and find creative ways to do it. And finally, let's use our churches and our houses of faith as well as centers for this. So the nourishment is not just spiritual, but it's nourishment that comes on deep physical levels as well, too. Lots of solutions I'd love to talk to you about at some other time.
Yeah. Well, thank you very much. Does anybody else have any questions for our last panel here?
I don't want to belabor the point. Thank you, Madam Chair. Can I?
Yeah.
I don't want to belabor because we do have to get off to public comment. But did you speak? I was out at a staff meeting. Did you speak at all to Reverend Heber Brown out of Maryland and what he's doing as it relates to churches and providing food and turning them into places for food markets, considering that's where black folks kind of migrate after on Sundays? Have you heard about this? Has there been any intersection with you?
Absolutely, yeah. Reverend Brown is a great friend of mine and a colleague. Reverend Heber Brown is the director of the Black Church Food Security Network. And I think it's based in Baltimore area because that's where he's based. But that's exactly sort of what I'm talking about. They are doing this ingenious work, and they're not waiting for the government to support them. They're doing this ingenious work of organizing what is still one of the most important features of black life, which is our faith, hands down. And in that, they recognize ingeniously that the one guarantee in most black communities, the one guaranteed space where black people will own the land and have, control of the land is our churches. And so they're starting there, and they're doing that, and they're making sure that every church gets a garden, right? I think that we can support that in ways, I think that there's lots of different avenues, but that's one, yeah.
Thank you. Thank you very much. Thank you, Madam Chair.
Thank you. I thank the panel for your testimony. And now I guess, Mr. Sham, we're going to go into our public meeting. If you would please announce that.
Yes. We have Liz Hagedorn, John Rosser, and Gregory Holston.
How many speakers? Good afternoon. Thank you for your patience. In the interest of time, could we limit it to 2 to 3 minutes? Yeah, and we only have 2, so I was going to say 2, so let's make it 3. And please state your name and proceed with your testimony.
I'll be brief.
Thank you.
Thank you. My name is John Rosser. I'm the general manager of Weaver's Way Co-op. We operate grocery stores in Mount Airy, Chestnut Hill, and Germantown, and a seasonal farm market in Roxborough. Thanks for giving me the opportunity to speak with you. The human impact of the SNAP benefits stoppage is the most critical issue here. We know that, and it's deserving of our foremost attention. But I would like to also express how grocers throughout the country are being harmed. Whatever its flaws, SNAP is an efficient way of using our existing food infrastructure to get food into the hands of people in need. Grocers base their inventory purchases, staffing levels, and retail spaces around anticipated customer demand in every community throughout the country. That demand is partly based on SNAP purchases. In some of Philadelphia's neighborhoods, grocers rely on SNAP customers for more than 50% of their total sales. Most of these grocers are small, independent businesses. The longer this crisis lasts, the more likely those grocers may be forced to lay off staff or reduce hours of operation or perhaps go out of business. Anyone who claims that they are pro-business, anyone who claims that they are pro-jobs should be outraged that SNAP benefits have been stopped. At Weaver's Way, we have responded to this crisis by leaning into our community ownership model. We have created a cooperative food fund, and we have asked our members who can to make modest donations to the fund, donations that will then go to support their fellow members who have been negatively impacted by the federal government shutdown, whether SNAP recipients or otherwise. Since we launched this fund last Thursday, over 1,000 of our members have donated just over $125,000. Which will allow us to provide food credits to our members in need for at least the next 4 weeks. And I'm confident if the crisis continues that our members will continue to step up. We have been touched by the generosity of our fellow Philadelphians, and we really do see this as an opportunity for us to come together as a community. Thank you for your time.
Thank you so much. Please state your name and proceed with your testimony.
My name is Reverend Gregory Holston. I am the Executive Director of Just Nation and a part of the Coalition to Defend Democracy. That coalition is made of about 20 different organizations, unions, neighborhood groups, and we've been doing town halls, actually before the last election on Project 2025, and town hall since. At our last town hall, we spent the whole time talking about food stamps, basically. The neighborhood and the communities, I know that we talked about the lines you saw, but the emotional stress that this is causing our community and our city, the impact of it cannot be measured. There are people right now who are hungry. As a pastor, I've pastored churches where we've done food programs, and I knew on a Wednesday night or a Sunday morning that if we weren't there with food, they would not eat that day. And that was when we had enough food stamps, a SNAP program. What I've heard from everybody here is that none of the solutions listed here can fill this gap. And I want to push back on that. I want to push back on that because I think even the administration said that the payments of SNAP in the city of Philadelphia is about $93 million a month to our nearly 500,000 residents. $93 million, and our budget is $7 billion. And we have a $1.2 billion surplus. And we have a reserve of $100 million that is available to us. I don't understand when the city says there's nothing we can do. When I hear those numbers, and I know people are going to be hungry, children are going to die because we're not doing enough. What is a reserve for? I think the council president said it himself. If this is not a rainy day, what the heck is? Why can't we do what was suggested? Take that $100 million, and I heard this part earlier today, which I thought was an incredible idea. Put it on gift cards, give it to folk, let them go to the grocery store and buy the food like they always bought it, and so that they can eat, and also our economy, as this brother just said, will still prosper. There are stores that have such a small margin that they will close if we don't do something to put money in the hands of people who go there all the time. This is not just a moral issue. This is not just a justice issue. This is plain economics. Not to do this, not to take that $100 million in reserve, not to take whatever additional hundreds of millions we have and use it for this. It hurts the city economically. People will lose their jobs. Those supermarkets, those grocery store people, folk who many of are formerly convicted, who are formerly incarcerated, who have come home and work in those supermarkets, they're going to lose their job over this. So why is not the outrage here, and why aren't we pulling every resource we have to meet the challenge? Now, I know this is city government. And it's hard sometimes to actually think really way out of the box. You know, we kind of just go back to the regular stuff we do. But some of y'all have got some practice out of thinking out of the box because you had to deal with a pandemic, which made you do stuff you never thought you would do before. This is one of those times we are faced with a man in Washington that is different than anybody else we've ever faced. And it's causing you guys as leaders to have to think completely differently than you ever heard before. I know some financial expert will say to you, well, that's not fiscally responsible. What? Can't think like that. Cannot think like that. We got too much to lose here. We got too much to lose. We got lives to lose. The last point I want to say on the economics. For every dollar you put in food stamps, you get $1.50 back in the GP, the gross product of that city. You put $100 million in for 1 month, you'll get $150 million back through all the stores from everybody who touches $1. And even more so, for every child you spend $1 on, for the life of that child, you get $62 back. Not only is it moral, it's right, it's just. Not only is it economical, it makes absolute sense. And so I need for y'all to have some courage, thinking out the box, whatever we can do in the faith community and these organizations I represent to be an encouragement to you. I know you have met difficult challenges in the past. You can meet this challenge today by spending the dollars you have now and trusting that you'll get them all back and more because you're investing in our children and in our people. Thank you so much.
I think that's great too,
Thank
sir.
you.
Yeah. I do want to add, I did see something that was great that the faith-based community did. I think Dr. Jamal Bryant, he told people as opposed to bringing money and tithes to his church, bring food, because it was a moment for everybody across this nation to step up to the plate. I just thought that was obvious. I think that was a great initiative that the faith-based community that I'll be willing to partner with, whether it's the black clergy, rather it's power, to do such an initiative, and we'll do our part on our end as well to advocate and be bold. And I appreciate you always for pushing us to think outside the box and go even harder and do more than what we can do, particularly during this moment in time, because everybody deserves to have an opportunity to go to bed with a full belly, you know? Appreciate that very well.
Absolutely. I just want to remark on that real quick. Giving food is important. I don't want to diminish it, but we have a system set up. And putting dollars in the hands of people so they can go to the grocery store and buy the products in that store is the money train, is the money cycle that happens to keep jobs in our community. And so while I appreciate all the work we're doing when trying to work with those people who push out the food, we got to keep that system going, because if that system doesn't go, people lose jobs permanently.
Yeah.
Stuff shuts down. Commercial corridors shut down because there's no dollar. I pastored on the corner of Germantown and Broad Street, and I was a pastor there, and they talked all the time about there's not enough dollars in our community to be able to sustain their businesses. They depend on folk getting food stamps. All the jobs on that commercial corridor depend on people getting food stamps. If they're not getting it, that corridor closes down.
Yeah.
And so I'm just saying, y'all got to just think a little broader about this. Yeah. This is big stuff when you take that much money out of poor neighborhoods each and every month. Yeah. And the final piece I just wanted to say again, I know I got a final piece all the time, but 12 years ago, a group that I was a part of called Power came here and pushed for a $1088 salary for those contracted workers here in the city, and was told that couldn't happen.
We did 15.
Mm-hmm. Then 3 years ago, we came back and we did 15, and I'm so glad you stood with us on that vote, councilperson. And we said then that one of the reasons we had to go to 15 is because their salaries have to be higher, because food stamps is subsidizing businesses from not paying the salary they're supposed to pay. If they paid what they were supposed to pay, we wouldn't need the food stamps.
Right.
So I'm pushing you this time on one more other part of that. A big jump. Go to $25. Go to say that every contracted city worker has to have at least a $25 an hour. That ripple effect will affect all of these businesses, all of the groups that are fighting for good labor contracts right now, affect all of them so that they won't have to get food stamps in the first place. If you want a long-term solution, pay people a fair wage and you'll get a long-term solution.
That's right. That's right. Well, listen, thank you. You're echoing what we have been saying about we should not have to do any of this, because people should have the agency to drive their own destiny, which means they have a living wage for what they do. But I wanted to point out something that you mentioned, the stress of this time. There's a price you pay in your health outcomes when you have stress like this. We had our physicians panel a little minute ago. That costs us. If you don't care about people's health, okay, but it costs us to have to take care of those health outcomes that happen because of the stress we are putting people under. To have a family not be able, or a mother or a father not be able to feed their children is the worst feeling in the world when you're a parent. And I'm saying that this is a moment, I hear you, that we need to be creative, think outside the box. We've already talked of ways to connect all the dots, to take out the bureaucracy and just put money in people's hand. I mean, that is the simplest solution.
That's the simplest.
Instead of going through all these things. And we know how to do it. Our commissioner just told us.
Yes.
She gives gift cards.
Excellent.
Just simple, straightforward, while we're doing all these other things and education and information. Yes, we should do all of those things. But right now, we can solve this immediately with a gift card.
Yes.
To those who need it. So thank you all for your testimony.
Thank you.
To everyone. Do we have any other questions for our public commenters? Thank you again. And I thank everybody for being so patient and sitting through this, because people who are not here, who are actually hungry, are watching us to say, what are we going to do? Who cares about us? You sitting here is showing that you actually care about someone else, because most people in here know how to have the ability to feed themselves. But there are people who are watching us, who are listening to say, what are we going to do to give a helping hand in a time of crisis? So I appreciate all of you, and we are not going to allow this to be normalized. Hunger should not be normalized, and we are going to do what we need to do, fight how we have to fight. We have to work. Obviously, we have to work across our legislative and executive branch to make sure that we are able to deliver for Philadelphians. But I thank all of you for being here. Stay tuned. We have work to do, and hopefully we'll be able to come back and give you updates on how we're going to proceed on things. So with that, yes.
I just want to thank Madam Chair. Could we give her a round of applause for stepping up in this space? Dr. Nina Mai is the chair of our Health and Human Services Committee, and so although we're addressing this issue in this moment in time, she's been on the case, as my mentor Hardy Williams would say, from day one on this particular topic. I also just acknowledge our Mayor Sherelle Parker and her team, and although I know that we can do more, I still want to acknowledge them for their leadership and still stepping up to the plate and addressing this issue comprehensively. Rather it's individuals who are being furloughed, rather it's addressing the food bank, rather it's giving DHS $1 million to put money directly in people's hands. I do thank y'all for taking a comprehensive approach and saying, here's how we're going to at least stop what we're doing, do an executive order within 24 hours to at least get this process moving in the right direction. And as members of council and the legislative branch, we will examine and look at how we can take it even further as we decide to move forward. So thank you very much for
And
being
thank
here
you to
today.
Council President for convening us. This was his bill. This was his bill that we introduced, and this is the result of that. So this concludes the business before the Committee on Public Health and Human Services today. Thank you very much for your attendance. All right. Well, thank you. Long day. Thank you for coming back.